distinguished guests. My name is Ashwell Jeniker. I'm the Deputy Director General from Statistics South Africa, and I'll be your moderator for this morning. We've got a lineup of very distinguished academics and scientists that will present to us today on the issues that follows COVID and how we've dealt with it as a country. We're going to start off with Professor Jonas Saletti, who is the Acting Deputy Director General from the Department of Science and Innovation, and he's going to set the scene to us. Thanks, Jonas. You go for it.
Good morning, Honorable Deputy Minister, Director General, the Statistician General, the Commissioner of African Revenue Services, distinguished participants, ladies and gentlemen, and all protocols observed. I have a few points to make just to provide the background to why we're having this plenary session. First of all, I think this has to be linked to the pandemic. And I want to say that the Department of Science and Technology was ready in terms of facing the pandemic. And I want to pick out on 3 levels. 1, on the policy level, 2, on the investment made in the NSI, and 3, on the leadership of the NSI, and also probably broadly at the cabinet level. At the policy level, we have the white paper on science and innovation that gave us key areas to focus on, and I'm only picking out on 3: coordination, partnerships, and focus on the social technical systems going beyond the departmental boundaries. And then the transdisciplinarity and the translatability of science for societal benefit. And it is at this time that when the outbreak of the virus happened, the initial focus of the work was more on the understanding the science of the virus. And so the focus was more on epidemiological part. And this is where the leadership matters in terms of the Minister of Science and Innovation raised an issue that we needed to include the social sciences in this work in terms of the Ministerial Advisory Committee's recommendations. It is this advocacy by the minister that resulted into the 3 champions: the Director General of Science and Innovation, the Statistician General, and then the Commissioner of the South African Revenue Services to champion this cause at the nut joints. And this is what gave rise to the National Policy Data Observatory. And it has a secretariat, and most of the participants in this forum today have been mobilized through that forum. So it is to this effect that the minister has called for this endeavor, and the deputy minister has been supporting this quest for the endeavor. We should have had quite some time back, but we thought it appropriate that we should have it on this session. So today's meeting is a continuation of the exploration of what the social sciences and humanities can contribute to the work of science in the country. Thank you very much.
Thank you very much, Fiona. I mean, that sets the scene quite nicely, and it's clear what we're here to do. And thanks for sticking to your time. I really appreciate that. Now, to do our formal welcome, I'm going to ask the Statistician General, Mr. Rethinking Maluleke, together with the Deputy Minister, Mr. Buti Manamela. They're going to do the formal welcome. I'm going to introduce Rethinking, and then Rethinking will introduce the Deputy Minister. So Rethinking Maluleke is the Head of Statistics South Africa, and is also the Statistician General of South Africa. That means that he coordinates and he facilitates the production of quality statistics right throughout the whole of South Africa. So without any further ado, let me hand over to the Statistician General, Mr. Senga Maluleke.
Thank you, Ashwell, and indeed, moderator for this session. When you put me with the Deputy Minister, I will follow the dictum that when the allegiance is upheld like that, I can just follow on Prof. Jonas Stiletti's messaging that indeed, with the leadership that has been provided by the Minister of Science and Innovation, who took this initiative of the National Data Observatory to his colleagues amongst the cabinet and indeed in other committees, where we were encouraged, that is the Director General of Science and Innovation, the Commissioner of SARS, and I, were encouraged to pull in all players, not only players from government or from the side of the public space or public policy, but also players from the private sector. And as you will remember, that we have further engaged with other institutions like the Actuarial Society of South Africa. Having said so, let me take the space to encourage all of us, those who are on this platform today for discussions, as well as those that we are linked with within our networks, to take part in this observatory, because it is working. But not only that, we are blowing its horn because we are a member, as Stats say, it is working and it is being institutionalized. And its institutionalization doesn't only rest on us being members, but in making sure that we put as much data on this platform. Furthermore, we also use as much of its products. Let me introduce the Deputy Minister, who will deal with the further remarks on the opening and within his right as a Deputy Minister. Let me indicate that you have made it a very difficult job for me, Ashwell, that I have to introduce the Deputy Minister, because I don't have to go and read on paper. It is someone I know, the Deputy Minister of Higher Education, Science and Technology, indeed has served previously as Deputy Minister of Education and Training, Higher Education and Training, and he had also served previously in the Portfolio Committee that relates to developmental issues in our state, but more specifically, he also served as a Deputy Minister in the Presidency, responsible for planning, monitoring, and evaluation and youth development, as well as administration. So he had a larger responsibility within the Presidency. But let me be specific and say that having served specifically in Parliament, as you know, our Deputy Ministers come from Parliament. He was a whip for Labour Portfolio Committee and the chief volunteer for Parliament as Nelson Mandela Day activities. When you take such a responsibility, it becomes a lot more. He emerges from the ranks of the South African Communist Party, and indeed having led its Youth Communist League from 2003 all the way to 2014. And he is an established politician in his own right. But furthermore, he has attained a master's in management in public policy at the University of the Witwatersrand. Let me mention that he didn't only attain that master's program director or moderator. He actually is an avid reader and a follower of empirical evidence. he will tell this story some other day when he was going through his master's in public policy. He actually kept us at Stats SA having to supply him with data all the time. So this is the right platform. Let me at this point in time to Mel.
Thank you very much, Risenga, for that introduction. And I think you forgot to mention that you were my boss when I was the deputy minister in the presidency, working quite closely with Statistics South Africa. Let me acknowledge program director, but also acknowledge the different representatives from various embassies, heads of government departments, vice chancellors, heads of science councils, distinguished guests, and more importantly, ladies and gentlemen who are part of this forum. It is my honor and privilege to welcome you to this ministerial plenary of the Science Forum South Africa on behalf of our Minister, Dr. Blakely Nzimande. There's certainly no doubt that the advent of the COVID-19 pandemic has heightened our consciousness about the important the importance role that science is playing in improving the quality of life of ordinary people. Logically, the natural scientists can speak with greater authority on the genesis or treatment of diseases. But we also know that diseases are in particular epidemics, impact people and societies in a multiplicity of ways. And because of this complexity in the impact of diseases, one particular scientific discipline cannot always accurately anticipate or respond to this complexity. It is for this reason that an approach that seeks to draw from the wisdom of all scientific discipline is the most sensible one. Arising from this reasoning and the need to ensure that our response to COVID-19 pandemic attracts the requisite number of young people into humanities and social sciences, but also for the purpose of enhancing the role of humanities and social sciences in informing public policy and discourse. The second issue that I want to emphasize is the need to foster a culture of multidisciplinary approaches to societal problems, and in particular during a time of crisis. And we've seen how cooperation between different and various branches of science have collaborated in helping us not only understand the pandemic, but also its impact and societal responses in what government and various role players introduce as remedy and as intervention. Multidisciplinary approaches enables us not only to draw from a vast and varying reservoir of scientific knowledge, but they also foster the importance of collaboration as opposed to competition. The third issue which I want to emphasize is the need to ensure that in how we develop research-driven responses to the COVID-19 pandemic, we must ensure that our research and the application thereof is culturally appropriate. Often, the reason why potentially useful scientific solutions do not get embraced by communities is because such communities often view the work of scientists and researchers as having no regard for their cultural norms and values, and in the same vein, therefore, alienate these communities from the interventions that scientists seek to make. This is particularly evident in the work that seeks to bring indigenous knowledge system to the center of our scientific responses. It pleases me to note that our emphasis on a multidisciplinary approach is not just wishful speak, but it is actually finding practical expression in the content outline of this plenary and in the selection of speakers and the institutions they represent. And I hope that through this interaction, we will be able to ultimately have this collaboration fostered amongst scientists. In conclusion, Program Director, I have no doubt that your deliberation will produce practical recommendations that will enhance our resolve to ensure that our COVID-19 response, that our response to the COVID-19 pandemic is as comprehensive as possible. A multidisciplinary approach, Program Director, is particularly urgent today, given the socio-economic impact of the pandemic and the need to ensure that through our economic reconstruction and recovery plan, we must ensure that most vulnerable in our society are not further marginalized. With these words, I'd like to welcome you to this plenary and wish that you have a productive session. Thank you very much.
Thank you very much, Deputy Minister, and very good seeing you again. My claim to fame is that I've spent half a day with the Deputy Minister when I was hosting him in Stats a couple of years ago. That's before we knew how many germs we've got on us. Life has changed now. We don't want to be close to each other. We're only seeing each other on the screen, Deputy Minister. Okay, let me hand over to Dr. Phil Mudwaga, who's the Director General of Department of Science and Innovation. And in all these initiatives around the National Policy Observatory and social science, we see Dr. Phil as our father. So Dr. Phil will map the path for us. So how does he see the issues of social science and observatory unfold over the next couple of years, and how do we make this step change to make sure that we stay relevant and build on the successes we've got? Thanks, Dr. Phil.
Yeah, thanks very much, Ashwell, Program Director, and thanks to the other speakers for providing some background. So I will make 3 points in this intervention. The first one is we've all heard of the 3 departments that came together, ourselves as a DSI, the receiver of South African Revenue Services, Edward Giswetter, and the Statistician General, representing those institutions. Now, what you will realize in all of these 3 institutions is that they are all driven by data and the use of data for informing society, with the Statistician General on an ongoing basis, providing us stats, with the Revenue Services as being a data-driven organization, an analysis of this data, and ourselves as a Department of Science and Innovation, having invested in a number of platforms, whether it's the high-performance computing and the previous platform that was set up at the Council for Scientific and Industrial Research to use data to inform policy. So the fact that these 3 came together is therefore not a surprise. But what is important, in my view, is that they have come together to provide a new way of looking at problems in government and in society. So the first thing that we still have a responsibility for, Ash, and the members of this session, is that we have to continue to demonstrate the value of data and science in decision-making. The COVID pandemic has helped us to do that and demonstrate that. And later on, you will hear the work that the Policy Data Observatory has been doing. So I'm not going to go through that. But I think this is a start of using data and science in its broadest sense to inform policy. So that's the first responsibility that we still have of how to do things differently. The second responsibility that we have is that in the decadal plan that we are finalizing as a Department of Science and Innovation, we have identified certain priority areas. One of them is climate change. And I think that whilst natural science can provide us an understanding of why we're getting the warming of the climate, we need social scientists to help us. What does this just transition mean? What does it mean for people in the street? What does it mean for job creation? What does it mean for food security? Now, we would need the interface between natural scientists and social scientists to work together to provide the country with what this just transition means. The second area in the decadal plan where I think the work of this team is going to be important is something which we call the future of society. Yona mentioned something which he called socio-technical system. What that means is that societies globally are undergoing major changes as a result of new technologies. But it's the interface between those new technologies and society that require that we think how science, as well as humanities and data, are going to drive the future of society. So I can go on and on and on and on, but my request to the humanities and social sciences is that please get ready to work with the natural scientists. And because I'm one natural scientist, don't be scared. We are very easy people to work with. So I look forward, therefore, to the discussions today, but I also even more looking forward to working with the humanities and social sciences in order to drive these new challenges in South Africa. Thank you very much.
Thank you, Dr. Phil. Thanks for guiding us on this one. There was a time at the beginning of the pandemic where we met Dr. Phil and the SG and the Commissioner of SARS every day. And every time myself and Jabu and Yona thought, now we've got it, then Dr. Phil would say, no, now you need to add this and you need to add that. Thanks for putting the bar so high, because I don't think we would have been here where we are today if it wasn't for you constantly challenging us and putting the bar very high. So now we're going to hand over to one of the chairpersons in terms of the observatory. It's Dr. Jabu Mutsweni, who's a technical lead at the CSIR, and he will take us through what is available and what the National Policy Data Observatory is about. Thanks, Jabu. Let me hand over to you.
Thank you, Eshwa, and good morning to the Deputy Minister, to the DG, the SG, and all the participants in this particular forum. It is my pleasure to be here, to be sharing some work that we are doing in the Data Observatory. And I think there's been quite a lot of work that has been done, and I know I've got limited time, but I will share some of the great examples that shows how important, data science is, particularly when we bring together, the technical people, the social scientists, and the likes. And my talk today will be dealing with data-driven decision making, particularly in the COVID-19 pandemic and vaccination rollout at times. And I think with the work that we do, there's quite a lot. So we are almost 2 years old, and there's been a number of products that I may not be able to go through all of them, but we'll just paint some background, and I think the DG has highlighted a bit of it, so I will just touch on it and focus mostly on what the National Policy Data Observatory its purposes, including some of the contributions that we're making now, and give you some relevant data on what is happening now with the fourth wave, and also acknowledge some of the collaborations and data sharing that we have, because the Data Observatory would not be what it is without all the collaborators that are assisting to either feed us with the data or to use some of the data that we are producing from the Data Observatory. And I think this point has been made a number of times, that when we deal with data and integrated data, it has the capacity, to make us get ahead of our decision making. Also, it assists us to be forward thinking, but to also have insights that generally we did not have when we don't have this data that we are dealing with. And I think also when we are looking at the data, it assists us to be multidimensional, where we look at various aspects. For example, if we are dealing now with health, we might be looking at issues of COVID, but we know that it's just not health metrics only. So we need to combine those or integrate or correlate them with other data sources. For example, understanding the social relief or the social impact that some of the health impact is having on our people, and including other issues such as your economics and governance and security as well. And then I think there's two aspects, but I'm just going to touch very briefly on this, is that when we consider, for example, the health data ecosystem, there's the number of data points that are available. It's so amazing, that are sitting in disparate platforms. You could look at the case detection data, the hospitalization data, which before COVID, many people would not necessarily know about it. We can talk about the data that is produced by Stats SA, particularly on the population statistics, the issues of vulnerability, service delivery. You can also look at the data about the movement of people, the security and stuff like that. But you could also understand a number of issues such as where people are gathering, and how is the virus spreading, just like now what we are seeing with the Omicron variant. But over and above that, that data alone, it just gives you a snapshot. But when you combine it with the social economic data, it then gives you a much better idea, so that you could make decisions, in a risk-based approach, because every decision that we take, whether it's about restrictions or any decision, whether it's about vaccination, it has the pros and cons. So this combination of various data sources, it assists, to give this wider view on how our decisions would impact in a number of social interventions in the country. And here you could be looking, for example, at data about the social and economic impact. As I've mentioned, you could look at poverty mapping data, the issues of elderly service delivery, and various other data sources. And that is why then when the National Policy Data Observatory was conceptualized, supported by the Department of Science and Innovation and hosted at the CSIR, the whole idea was just not about COVID. COVID-19 pandemic is a springboard, but we see this as a facility and as an initiative that is government-led, that informs policy, but over and above that, that provides insights on various socioeconomic indicators. And currently, the data that we produce is being used, at net joints in some of the interministerial committees, particularly the IMC, as well as working very closely with the Department of Planning and Monitoring and Government Communication and Information System as well. So there's quite a number of activities that are being done. I might not have the time to just go through all of them, but very key currently is issues of data insights, particularly doing secondary analysis, supporting the National Department of Health and other health institutions, supporting other programs of government, such as your district development model, with the data from Stats SA and other sources, understanding mobility of people, which could assist in various ways. For example, with spatial planning, it could also assist in understanding whether our restrictions are effective, monitoring the issues of curfew. And we work also with a number of institutions, our knowledge anchor institutions, to understand various social issues. For example, how people are responding to COVID, the issues of vaccine hesitancy, and various others. But over and above that, I think what makes the Data Observatory central is we are an observatory of observatories, because the other institutions will still do their work and collect their data, but we also look at outside the borders of South Africa, for example, the global trends, tracking our development indicators in line with the SDGs, and various others as well. So we also try to bring some of the research data sources together. As the Deputy Minister was mentioning, sometimes some of our researches are not accessible, but the Data Observatory is trying to fill that gap where we pull everything together, where it could be accessible in one area. And these are the active contributions. I'm not going to go through them, but very active in net joins, particularly from the technical data advisory, doing some work, modeling, forecasting, and projections on our vaccine program, as well as working with institutions such as GCIS, DCDT, understanding their communication campaigns, the issues of misinformation, and various others. So you could clearly see that the National Policy Data Observatory's work is very broad and diverse, and we continue to grow. There are a number of dashboards, that have been developed. Some of them hosted within some of the infrastructure supported by DSI. For example, the Center for High Performance Computing is hosting a number of our data products, and the reason for this is obviously we need power, computing power, including scalability and performance. And then just to give you an indication, and this is the latest update in terms of some of the NPDO decision tools, you could look, and this is the data that every day is collected, some of it automated from various sources. There's a small team, but working very hard to make sure that, when we provide updates, for example, into net joints through to NCCC, there is latest data supporting what the National Department of Health, for example, and NICD are seeing. And you can clearly see, for example, some of the analysis that we are doing, where we are able to pull the historical data of what happened last year in December, showing how the trajectory, for example, of the current wave is going, whether we are doing good or we are doing worse in terms of the infections, but not only in terms of the infections, also in terms of the hospitalizations, in terms of deaths, and other issues such as mobility, which I will share. For example, if we just look at a snapshot of what has happened over the past day, you can see that our cases are climbing up very rapidly, particularly in Gauteng, where they are increasing also very, very high. We can see that the number of tests that are coming up positive, they are almost at about 145%. And based on the data that we see, Gauteng, for example, is already in the fourth wave. And all of this, is done at an instant. It doesn't take a week, for example, to get some of these insights, because they are readily available in the NPDO. And we pull all of these data sources from different places in order to correlate. For example, we can even go into Gauteng and see how they are performing, where, like yesterday, they had almost about 8,000 positive cases of the 11,000. So the epicenter is definitely in Gauteng. We see, for example, that the positivity rate in Gauteng is already over 20%, which is a little bit of a concern. But here we are just still talking about infections. The city of Johannesburg and the city of Tshwane being the main contributors there, with over 36 and 30% increase respectively. We are also seeing that hospitalizations in Gauteng is increasing. But it's important also because when you look at the stats and you don't put them into context, sometimes they can also lead to wrong decisions. But we are also seeing these increases is because we are starting from a low base, compared to the previous years. But the concerning thing is that we have almost surpassed now the trajectory of where we were at the same time last year. And then some of the other things we look at is the weekly positivity rate. For example, this is zooming into Gauteng to see how things are shaping up, whether some interventions need to be put in place in order to cap the spread. Those are some of the things, for example, we give inputs to in the net joints. But over and above, we don't just look at one indicators. We can look at deaths, which is also another impact indicator that we look at, particularly when it comes to understanding the pandemic, because we can't just look at cases only. You have to correlate the number of these. So we can see, for example, in terms of the deaths, those ones have been very low. They have not spiked up, but we also understand that there's sometimes a delay in the number of deaths. But so far, the trends, even when you look at excess deaths, which is also another good indicator of when the pandemic has entrenched itself in the communities. But we see that now the Omicron, even if though it was detected early in November, we can see that it has not really had that impact or much impact on the deaths, which is a good sign, probably because of our vaccination program as well. And then the other thing we do is the issues of mobility. We can compare what has happened in the previous year in mobility at different areas, whether it's in the retail sector, in the grocery and pharmacies, in the public transport. And we can clearly see, for example, when you look at this, that the darker lines, that's the 2021, the movement have been very high, particularly after the end of the third wave. We can see the movement has been very high in this year. Of course, with the cases, at least after the 8th or so of November starting to spike up. But of course, as I said, when you look at these numbers, it's always important to consider them in different ways. We also track the trends in terms of where the restriction levels have been at different points, so that, you know, the decision makers could have a full picture of what to expect or what decision that needs to be taken. And then we also use other data sources such as the South African Modeling Consortium, showing the issues of hotspots. Yes, yeah, I'm wrapping up in the hotspots. So we also have that where we can show some of these things, and there's various others such as your tracking the variants where they are at, like the Omicron now, which is mostly dominant in South Africa. The issues of vaccination, interesting trends that we are seeing. For example, as the cases are climbing up, we are also seeing a rise in the demand for vaccination, which is of course a good thing, which is this slide. And then there's also some modeling that we do where we are, you know, be able to predict when a particular threshold or targets are going to be reached in terms of vaccination. And then as well as, this is the last slide as well. And I think all this work that we do is because of the collaborators and various data sources that we get. You know, we look at the wastewater surveillance dashboard from SMRC. Those are the kind of data sources we use. Say there's a lot of their data that is being used in the data observatory. And recently, you know, we also at international level working with Our World in Data, where we are sharing some of our data with, because we also have been using a lot of their data. And I think in conclusion, data, it has been proven that it is very critical towards decision making and to be able to meet various demands. And I think as we collaborate more and tap into some of these excellent capabilities in the NPDO and other research institutions, we'll be able to make more better decisions and take the country forward. Thank you very much, Chair.
Thank you, Jabu. Still unbelievable to see all this coming together. I think the National Policy Data Observatory has achieved more in this last year than I've achieved in my 23 years in Stats SA in terms of promoting and making sure that people make evidence-based decisions. Very well done. So now we're going to hand over to our next speaker, who's Sarah Mosutza. Now, if Dr. Phil is our father, Sarah, then you would be our mother.
Oh, now, my goodness.
not in a biblical sense, in a humanities and social science sense. So thanks for joining us. Sarah is an associate professor at WITS, and she's the chief CEO of the National Institute for Humanities and Social Science. And Sarah will give us a sense of the landscape in terms of social science in South Africa, and also give us some sense of where things should be heading towards. Thank you very much, Sarah, and thanks for being here with us. Good to see you.
Ashwa, thank you so much for being patient with us and leading us in the last 18 months. I know that it has been also difficult trying to figure out what are these social sciences demanding and wanting. And I particularly want to thank you for all the work that you have done. You've done an incredible work for the country, actually. Deputy Minister, good morning. Our DG, who's also has been holding us together under difficult circumstances. To Mr. Maluleke, thank good morning to my colleagues as well. All protocol observed, and I am rushing because I only have 10 minutes, and I have a few things that I want to share. And obviously a special welcome to my colleagues who we've been working very closely under the National Observatory led by Dr. Seleti. Let me just maybe with intro remarks say that for us in the humanities and social sciences, we understand that this is what most and what we are also defining as the COVID decade. It has led to a number of devastations and tragedies, both at different levels, social, psychological, even political, we have witnessed, and most importantly, also at an economic level. For us, this human age, or the age that we are grappling with, this decade that we are grappling with, has led to serious clashes between us as human beings, our environment, and I was happy to hear the Deputy Minister also mention the environment, as well as technology. As the humanities and social sciences, through various research that we have conducted, we know, working with policymakers, that this clash could easily be turned into a coexistence of people, our environment, and technology. I want in now the 9 minutes that I have, at least share with colleagues and many of you who have joined us, share with you some of our key learnings from ongoing research, and some of the research has also been concluded, multidisciplinary research that we've conducted since since May last year. I must add that research has always been supported by the Department of Science and Innovation, Department of Higher Education and Training, and most of it has also been initiated by the various discussions that we've had as part of the Observatory community. So allow me to share at least insights from a number of projects that we've initiated as NIHSS, we've led as NIHSS, the National Institute for the Humanities and Social Sciences, in partnership with the various universities. For us, the analysis indicates that there can be and there should be that coexistence, not only in terms of the broad thematics that I've just spoken to, but also between the sciences. I think it is important that the sciences also coexist as we grapple with a number of challenges, including this challenge. There are four issues that I want to focus my input today on. Drawing again, I want to emphasize on various research. First, what we know from research is that there are long-term implications around structural inequalities that we need, to grapple with. And in the work that Professor Chur and Professor Valodia have been doing, work at Wits University, also working with colleagues at UCT, in the broad thematic project entitled Rethinking Economic Policy for South Africa in the Age of COVID-19. And that research that we supported speaks particularly of how we can address in the long term our structural inequalities that COVID-19 has brought to bear. They conclude that government can use the COVID-19 crisis to think about how government and us, we can move from a reliance on wage labor as a revenue generation tool. That heavy reliance should be mitigated by at least an emphasis on and going back to our rethinking of social security. I think again in the work that has been happening at Walter Sisulu by Dr. Nelly Shapley, what we know are the long-term consequences in education as well, basic education, that an investment in education is a long-term one. And what we are seeing is what we call and what we term COVID school dropouts, that those COVID school dropouts have long-term implications for the country and in how we have always thought about education as a potential for resolving our poverty and inequality crisis. So I think for us, the first thematic is around long-term implications of COVID-19, particularly around inequalities with a particular focus on also education. The other part of this long-term implications of COVID-19 that we've discovered through our own research around in townships is that, of course, COVID-19 has had different impact based on your locality, your gender, but most importantly, your class location. And we've noted through that research, and also the research that has happened, that is also ongoing at the University of Johannesburg, what we again calling the COVID gender gap. The second thematic, and I know that I now have about 5-6 minutes. The second thematic is on knowledge integration, and I started with this thinking around how the sciences need to be talking to each other. And I am privileged to be in a country that still recognizes the humanities and social sciences as a science and as an equal science. There's a long way still that we need to go, but that we are even having this led by our deputy minister and our DG, I think says a lot, where in the world over, the humanities and social sciences have been sidelined, much to the detriment of those countries. But it's not just the sciences. I think that all sciences should also have a deliberate interface with policy, and that's what the Observatory seeks to do. What we also know is that history for us as humanities and social sciences, we've always said that history repeats itself. And what we don't want is that as it repeats itself with another crisis or another pandemic, that it finds us unplanned, uncoordinated, and not working together, because indeed that will be a big fuss. The third of the four thematics that I want to talk to, that the research has also pointed out, is the need to rebuild our communities, from the households to community organizations that have played an important role in holding our communities even during difficult times. I think for us as thinking around the concept of rebuilding communities is not political, but rather that we need to understand how crisis also puts, I think, to light issues around power, who speaks for who and for what purpose. And what we found is that for COVID-19, it has been largely talking for others, on behalf of others, and through the work of that's happening at UWC, very interesting work at UWC, showing the importance of everyone, especially those who are most affected by a crisis, speaking for themselves with using their own language, whether it is through myth making, which is an important tool of telling your own history so that you are better empowered to also deal with your own crisis, through another form of telling a story, storytelling through puppetry, for example. And the arts plays an important role, and that work that's happening at UWC is an important work as we think about this crisis and future crises. As we also think about rebuilding our communities, there's also the last theme that I want to talk to, which is rebuilding trust within communities, but I want to emphasize particularly with organizations working with different other role players, including a government. Here I want to make specific mention of the work that we have been doing with a cultural and religious commission, and talking to faith-based organizations, and how hard it has been for them in thinking about themselves as organizations in crisis, themselves instigated by the crisis of COVID-19, but how they are also bemoaning how they have not been consulted, and therefore communication and communication. Our work with faith-based organizations also revealed nuances and new understanding around vaccine hesitancy, and that's where we are as a country. And I think that research points to where we could make inroads around our vaccine hesitancy, using or working collaboratively with faith-based organizations. Yes, it is about about social solidarity, that the work that some have done, and negating the whole notion around social distance. We want the idea there with that research is that it is physical distance. Physical distance should not come at the expense of social solidarity, which builds on our history as a country. My concluding remarks, as I conclude, Chair, hope I didn't take a lot of time, is that for us, in the humanities and social sciences, and there are many other individuals, and I don't intend speaking on behalf of the humanities and social sciences, but for the number of research and projects ongoing and concluded, we can indeed conclude for now that the COVID decade is a tragedy, that however, through research and coexistence of knowledges, working with policymakers, we can indeed prepare for a post-COVID world and prepare for future pandemics and crises. And I want to thank my colleagues in the Observatory for nudging all of us to do the work. And Ashwa, thank you so much for your leadership.
Thank you. Thanks, Sarah. And thanks for sticking to the time. Thanks for highlighting the scope of the challenge and knowing where to put our energies. I mean, we at the end of the day, there's only so many resources available, and we need to make sure that we channel those well. And thanks for highlighting where one should put those. Now, when it comes to the policy data observatory, there's two parts to it. The one is the actual data. That's the data that's used for decision making. But in order to sharpen the saw, I mean, we've decided that one needs to include some research to point us in the right direction, or to give us some secondary analysis, because the data can tell us the basics about where the pandemic is, but sometimes you need to drill a bit deeper. And the next set of presentations, speakers are going to give us a sense of the research landscape. And firstly, we're going to have Prof. Mark Conlinson and Dr. Kobus Hertz, and they are from the South African Population Research Infrastructure Network, SAPRIN. And they've been very instrumental in terms of helping us in the data observatory, in terms of the research that they've done to make sure that that feeds into net joints, and to make sure that we're making the right decisions based on research. Thanks, Mark. Let me hand over to you at this stage.
Thank you so much, Ashwell. As always, it's such a privilege and a pleasure to be talking with the colleagues around the table today. But thank you indeed to the Science Forum of South Africa and to the NPDO, which we are all giving an important profile and reflection on today. And I'd like to continue in that vein. I will just share my screen, pardon for a second. My contribution, and I think if you'll forgive me, I'm just going to turn off the video to preserve space for talking. SAPRIN is a major long-term investment in a national research infrastructure. It's been funded by the Department of Science and Innovation and hosted by the South African Medical Research Council. In this presentation, my aim is to show you how we've been able to contribute in the way that we've heard important other presentations earlier to the National Policy Data Observatory to build up the knowledge that people whose primary goal is at the apex of government, making the decisions, thinking about how to resolve the crisis, to have relevant information, scientifically verified and coming at a regular basis. This is proving to be a very interesting and important thing. And so we're very happy to be part of this. We currently at SAPRIN have 4 nodes, each with a surveillance population of around 100,000 individuals. The 3 rural nodes have been in operation for more than 20 years. So the data I want to tell you a little bit about vaccine hesitancy are from these nodes. An urban node in Gauteng started this year. It is still busy with their baseline enumeration. The node in Cape Town will start next year, with nodes in eThekwini and Eastern Cape following after that. These nodes all follow a common research protocol based on enumerating a complete population in a defined geographic area and geolocating each household. This baseline population is followed over time by contacting each individual 3 times a year and recording every birth and in-migration, also new households that were not enumerated before, and then the outflows through mortality, deaths, and through out-migration. These are all recorded. And this becomes a detailed longitudinal database of the population. This, as has been highlighted, and the importance of open science at this current time, especially in relation to the epidemic, is a crucial part. And being a national research infrastructure, the data that I'm talking about here are now in the public domain, and we work hard to keep that accessibility clear and open, and also safe from the point of view of anonymity of the populations involved. In the case of these 3 established nodes, we have almost 570,000 individuals ever identified, representing about 4.5 million person years of follow-up. And then there are nested studies in these populations where biomeasures are recorded, like heights and weights, blood pressure, with genomic data. And this also lends itself to record linkage for administrative records, such as medical records, educational and social support. So in a sense, and in strong embeddedness and with keen relations within communities that are poor and under-resourced, this represents a powerful research infrastructure, but aimed at investigating and intervening to improve health and well-being of these populations. With this infrastructure in place, we were able to adjust quickly to a monitoring process with 20,000 households involved in each of these nodes. It eventually came to this, we worked our way up to it, but we were able to start recording in April last year of people's experience with COVID and the non-pharmaceutical intervention measures. And so this kind of ongoing update within a random sample of, and then eventually within the whole population, this is repeated every 3 months. Why this is important is that it's one of the few opportunities to look at this epidemic in the population context. Also, community effectiveness studies are possible, and evaluating long-term health outcomes. I want to just quickly in this short time show you 3 types of data, which is an example of the kind of thing that we will continue to do. And it's one of different domains where we're working. But in terms of vaccines, who's had a vaccine dose? This is number 1, where 120,000 people's data are here. Vaccine willingness, 200,000 people's data. If a vaccine was available right now, would you be willing to take it? And then if not, what are the reasons for hesitancy? So briefly to say, we're tracking over time. So since I last reported to NPDO colleagues, we have 5 months of new data showing from May to September. And each of these bars is a different one of the saccharin nodes. By now, this is the over 60-year-old population. And by now, in all of the nodes, over 50% of the population have been vaccinated. It's less in the younger ages 35 to 59. You see, Dimamo in Limpopo shows the highest proportion of vaccination in all of the examples. And obviously younger people haven't made it yet, but to the same extent. Now, the willingness to receive is very interesting. And here we see some shift in time because we've accumulated the 5 months of data, May to September on the left, and then showing only September on the right. What we can see in these columns, the tallest column is who definitely would take it right away. We see that's at about 40%. There's already more than 25% are vaccinated. And some 20% probably would. And then there's this kernel that definitely would not, that may be getting less over time, and certainly the definitely would's, the people who definitely would take the vaccine are reducing as they become vaccinated. This is an example of what a dynamic cohort can do, you see. So each week here, now we have a week going along the x-axis, week by week through May, June, July, we're able to look at the proportions of people in those different types of willingness categories. And so steadily we see vaccine uptake growing, but there does remain a kernel of the people who are hesitant. This complex looking graph is really telling us what are the reasons that not to take a vaccine have become the most dominant in the discussion. And the different colors in the histograms are data from the different nodes combined. And the summary of this is to say that there is essentially not having a reason to not take the vaccine is a prominent thing, but allergies, don't like needles has been a very prominent thing, and worrying about the side effects. And as we get, as time goes by, there are more people who seem to be saying we don't want it because we don't think it will work. So in very quick summary now, just a slide about these results, and then I will just say a few more things about our relationship with the NPDO as an anchor institution. So the vaccine rollout is making progress. The apparent trajectory using the SAPRIN data is pointing towards an 80% vaccine update if those willing are able to access, which we think they will. There's still a minority of hesitant individuals. Some over 60s are willing to vaccinate, but not yet done so. Reasons to avoid the vaccine are a mixture of generic and COVID-19 specific reasons. Greater COVID vaccine specific reasons occur among hesitant individuals. But there are avenues for changing minds because many of the points that are raised are not actually fact-based. There's some variation across these HDA sites, but it's a relatively consistent picture. So this is an example of SAPRIN's contribution, and this is an ongoing updated thing. It will be 3 times that I have presented vaccine data like this into the NPDO. People are very encouraging and value the work, especially the population platform. Through here, what is a privilege, and it works better all the time, it's working well, is that we get advised by the senior colleagues in the NPDO where this work needs to gain some traction, who needs to hear this, and then then there's a sort of channeling process into the correct policy-making committees. Other topics that we've contributed on this year are about some of the behavioral aspects of people, especially in relation to COVID interventions, but also we work closely with Statistics South Africa and Department of Social Development on youth migration and livelihood prospects and how this has been impacted by COVID. So migration and urbanization is a domain that we will continue. And lastly, as the country is hoping and striving through policy and human effort to claw our economy back and get it back into an upward trajectory, SAPRIN will be there taking measurements and in step with these communities in order to be feeding this information in a respectful, anonymized way, but being part of this communication that others have been speaking about. So I will pause there now. Thank you, Chair.
Thank you. Thank you very much, Mark, and thanks for your contribution. Our next set of presenters would be Prof. Narnia Bowler-Miller and Dr. Benjamin Roberts. They are from a partnership between the HSRC and the Center for Social Change at the University of Johannesburg. Now, the issue of vaccine acceptance and hesitance is a very important issue. I mean, the president, when he spoke the other night, said the only way we're going to overcome this wave and the pandemic in the future is if we all take up vaccines. So thanks, Ben and Arnia, for your research. Let's see. Let me hand over to you to present on this matter. Thank you.
Thank you very much, Chair. While Ben puts up the presentation, I just want to thank the organizers, Science Forum South Africa, for allowing us to present, and greetings to...
Sorry, Narnia, let me just ask Mark. Mark, can you just stop sharing your screen?
Thank
Apologies,
you.
Narnia, you go for it.
No problem. Greetings to the Deputy Minister, the DG, and a special greeting, of course, to our acting CEO, Professor Leibniz Simbai. I'm going to hand over to my colleague, Dr. Ben Roberts, who will be dealing with the first part of the presentation.
Yes, good morning, everyone, and thanks for the opportunity. I'm going to jump right in. I think we've heard from previous presenters about the expansive growth of South African social survey infrastructure over recent decades, particularly post-1990. There was appreciable investment.
Sorry, Ben, the presentation isn't up.
Okay, that is very strange. It's displaying on my side, Danya. So let me just see. That might do it. If you can just confirm, please.
Yes, it's up now.
Yes.
Thanks, Ben.
Thank you. Sorry about that. So we've seen this relative expansion through large-scale investment in high-quality, academically driven social survey infrastructures. Some of these have had a focus around cross-sectional comparative analysis, and that includes the World Value Survey, Afrobarometer, our own South African Social Attitude Survey. As Mark was just talking to, there's also been real investment in panel study research. So SAPRIN and the nodal sites is one set of examples. Others are the income dynamics surveys, including the KwaZulu-Natal Income Dynamics Survey, as well as the National Income Dynamics Study, as well as the Birth to 20 Plus cohort. There have also been area-based studies, such as GCRO's Quality of Life series and the Cape Area panel studies. And also, importantly, the official survey series from Stats SA, focusing on capturing social dynamics. But obviously, the COVID-19 pandemic and the lockdown regulations has brought the great disruption and postponement to many of these series, and it's had a very immediate impact, particularly leading to the suspension of face-to-face data collection in many cases, including to Stats SA. The only exception was certain, particularly in the early hard lockdown phase, certain biomedical studies. So this has obviously had a knock-on effect on the scheduling of social surveys. It's produced a context of relative uncertainty in the field and the kind of conditions that would lead us to go back to face-to-face interviewing. Also, it's raised fundamental questions about ethics, the safety considerations we need to put in place associated with in-person interviewing. So the fundamental challenge that's posed for us is really to try and maintain these local and international obligations to provide policy-relevant social data during a time of broad-based covariate risk, as well as uncertainty. It's also created the imperative for creative solutions in the face of many new challenges to conventional surveying practice. This has, for many of us, prompted experimentation with online panels, mixed method studies, and other approaches. Some of us have also tried to pull together shared lesson learning around methodological surveying during COVID times through online webinars. But most importantly is the crucial need, and I think that's a recurring theme, is to ensure decision makers were supplied with the social data that they need to inform their understanding of the pandemic's impact on society and the social policy choices they need to put in place. In terms of the HSRC itself, the pandemic had a direct effect on our nationally representative attitudinal series. We had actually begun our fieldwork in Feb 2020. The hard lockdown, by the time the hard lockdown, we'd done about 40% of our annual round. We were only able to resume following ethical clearance in November, and we managed to finish eventually in February 21. We've now gone back to field most recently in the last couple of months and are just wrapping up at present. So in the interim, what did we do? So we actually formed a creative partnership with the University of Johannesburg Center for Social Change and established what we call the COVID-19 Democracy Survey. We've administered to date 5 rounds of surveying. The first one conducted in the hard lockdown phase in mid-April to mid-May. And the most recent one was in late October to mid-November. We made use of a data-free platform and an app called Moya Messenger. It's got about a user base of about 6.5 million active users. All usage of the apps on that device on the app are purely data-free at the user end. Yes, it was a convenience sample, so it's non-probability with respondents opting in, which obviously does raise issues of representativeness of our sample and concerns potentially about undercoverage and non-response, potentially creating some element of bias. We worked with the former Statistician General to benchmark our data to say population estimates, to really give a sense of broad inferences generalizing to the South African population. We've used this methodology in other ways recently as well. We've looked at elections and COVID-19, working with the Electoral Commission. We've looked at attitudes towards social unrest, and at the moment we're looking at views towards the Zondo Commission. So very similar measures we've actually looked at, and this is the example we're going to talk to, is around vaccine acceptance and hesitancy, very similar to what Mark was talking around in the Sapring case. So we've looked particularly from round 3 in late December, early Jan, at several questions. One is about the willingness to take the vaccine if it became available to you. So our coding and so on is quite similar to what Mark had detailed. And also a follow-up open-ended response that we subsequently coded, asking response to explain in their own words the reason for their acceptance or hesitancy. I'm just going to give you a very, very truncated view of some kind of high-level findings before handing over to Nanya. Firstly, in terms of the willingness to take in both rounds 3 and 4. So rounds 3, as I said, was December, Jan last year. Rounds 4 was in the middle of the year. Round 5, we've just recently completed. So I'm looking particularly at rounds 3 and 4 for now. We saw between those rounds, acceptance increased from 67% to 72%. And those tendencies, that 72%, is kind of broadly similar to what Nutscram found, and also in terms of the tendency, a slight increasing tendency over time. And it also replicates what Mark's just talked about in terms of the tendency they're finding at their nodal sites. So 72% is fairly positive news, as indeed the upward tendency, but it does fall short of the government's target of vaccinating 80% of adults. So there remains a substantial gap between intent and actual vaccination, and we're trying to really understand what those barriers are, both attitudinally and in terms of access-related barriers. So some of the hesitancy-related fault lines our analysis pointed to, firstly, in terms of demographic factors, we did find age, race, and education show clear patterns of variation in levels of acceptance, and we found hesitancy was more concentrated, particularly amongst the youth, and amongst white adults. It was also quite concentrated amongst suburbanites, and also we found a clear sort of educational divide, with better educated showing certain skepticism towards taking a vaccine. But we did find that this salience diminishes once we control for other political support measures and other factors. Of a special note was the role that's played by evaluations of the way leadership is handling the pandemic, and particularly presidential evaluations and government, particularly national government evaluations, but it equally applies to other core institutions, including policing, the defense force, and other key political institutions and their role in the pandemic and regulatory enforcement. The other one is something that Nanya and I have been looking at quite closely, is the issue of willingness to sacrifice for the common good. And I think that relates back to some of the social solidarity focus that Sarah was referring to. So those are very strong and very salient. We find that some of the earlier demographic correlates, particularly age and race, lose their significance once we do control for these, but the educational effect does remain. We also found that men tended not to be more hesitant on average than women, but they did have lower vaccine uptake. So that's due to a combination of access, hesitancy, and the general inclination towards delaying the seeking of healthcare. On the open-ended side, we coded both the vaccine acceptance and vaccine hesitancy motivations. The dominant reasons for acceptance was a driving sense of the need to protect both oneself and society. Amongst the hesitant concerns about the side effects and the efficacy of the vaccine predominated. And this was true across a range of socio-demographic correlates. The explanations for vaccine hesitancy related to social media, to conspiracy theories, and religious objection were only held by a very small minority of cases. I'm going to jump quite fast now. So in terms of promoting acceptance, with more, around about a quarter to a third still hesitant, more public education is clearly required. So we have been engaging with GCIs and others on vaccine rollout communication. The required communications approach does need to be nuanced, sensitive, and targeted to the concerns of varied constituencies. We found that knowledge of vaccines really matters for acceptance, and that understanding the preferred information channels is crucial for targeted campaigns. Conventional media does still dominate, but social media and online news sites were notable secondary sources amongst the youth in particular. And in terms of the content itself, it's really trying to provide core information, address the concerns, particularly about side effects and efficacy, and also trying to, at the same time, do a bit of myth busting. So last slide before I hand over to Nanya is really one of our key emphases is really on trying to reach that movable middle. The probably will get the vaccine and those who are uncertain. And most of the uncertainty was about lack of information. The bitter einders, as we call them, on the red side, you know, it's really going to be tough to change hearts and minds. So we focus firstly on that movable middle. And so the message needs to target hesitancy, but also importantly, raise awareness about how to access vaccinations. And giving this due consideration to access barriers is critical in trying to minimize the risk of escalating vaccine inequality. So with that, I'm going to hand over to Nanya for a few summative messages.
Thank you, Ben. So towards post-pandemic society, some of the main reflections from our research are really around a greater need for experimental and investment in multi-method data collection and sampling approaches. So innovation is extremely important at a time like this where it's no business as usual. We need to continue to ensure that the citizen voice emerges and that we know what the social dynamics are, and to feed this into policy processes and regulatory decision-making. Unfortunately, we've been able to do so because of the seriousness of this research and the fact that government is open to scientific reasoning. Next slide. So in providing this evidence, there is some concern over a possible tension between a methodological pureness and this experimentation. So we are looking at the need for robustness checks, and 3 of them could be sharing and comparing findings across survey research infrastructures, which we're actually doing today, role for partnerships with the Data Observatory, which fortunately we have, and then replicating measures in representative survey series when possible. So what are the next steps? Well, in terms of our partnership with the University of Johannesburg, we have completed round 5 of the COVID-19 Democracy Survey, as mentioned by Ben Roberts. We're working on a report dealing with views on vaccine mandates, and there are some interesting findings there, as well as looking at vaccine hesitancy once again. There are signs that people who want to get the vaccine are in fact getting the vaccine, but there is a core of people who are still hesitant, and we need to take a look at that far more closely. We'll also be examining new vaccine attitudes data from the South African Social Attitudes Survey 18th round. And this will certainly allow us to check and counter-check what we have done up to now. And we are looking forward to ongoing engagement with government and other partners as we continue to do this work. Thank you.
Thanks, Narnia, and thanks, Ben. I mean, very interesting questions there, especially for us at Stats SA, as I mean, we're also in the business of collecting data, and we see it's getting more and more difficult to get people to participate. And so thanks for looking at these issues and see how do we map the way forward in terms of making sure that we still get good quality data at the end of the day. Our next speaker is Prof. Riza Daniels. He's an associate professor from UCT, the School of Economics. And so when Jabu presented, you saw that there was two data systems, data ecosystems. So on the one hand, you had the health side, and then on the other hand, you wanted to make sure that people don't die of hunger. So Riza is going to give us a sense of how that socioeconomic, how this pandemic has affected people socioeconomically, and that sheds some light for us in terms of how do we make sure we protect our people. Okay, Riza, that's not you to stop. That's the previous one. Welcome, Riza. You go for it.
Thanks, Ashwell. Can I just confirm you can see?
You're starting to share your screen now. It's not yet through.
Okay. Hello?
Yes, I can hear you. Maybe you should just try again, and maybe you should go without your camera just to see how that goes.
Okay. I shall turn that one off and now look to share my screen again.
Okay, go for it.
How's that?
Yes, we can see it and it's clear. Thanks, Riza. Go for it.
Great, thank you. And thanks to the MPDO for the opportunity. Minister, Deputy Minister and DG, as well as our other distinguished guests, it is my pleasure to present an overview of the findings of the Nutscram survey. It was a survey that ran from March 2020 to July 2021. And in so doing, we captured the impact of COVID-19 as government initially implemented lockdown level 5. We saw every 3 months we went back into field, so we captured lockdown level 5, lockdown level 3, lockdown level 1, the return to lockdown level 3, and then lockdown level 1 again. So Nutscram was funded by private philanthropy funders, the Alan Gill Gray Philanthropy Foundation, the FEM Foundation, and the Michael and Susan Dell Foundation. It is the largest non-medical study in South Africa, and it was designed specifically to capture some of the social and economic implications of what was happening in response to COVID-19. We used the NIDS 2017 survey as a sampling frame, and we drew a sample from that. We had over 30 researchers from 6 universities working on the data, and we have made sure that all the data is freely available to the public. We also commissioned 67 working papers, which are freely available on the website cramsurvey.org. What I'd like to do now is just highlight some of the key findings and what new information they brought to our understanding of the impact of COVID. And the reason I'm going to focus just on the new understanding is because I think that what Nutscram brought to the table was a view of the social economic impacts through actual interviews of a nationally representative sample of individual adults in South Africa. What we'd seen in the early part of the pandemic was a lot of epidemiological studies predicting the potential impact of COVID-19 on mortality, which is sickness, and morbidity, which is death. What Nutscram did is, instead of using models, we used actual data so that we could compare between what the models were predicting and what the data told us was actually happening. And the data told some fascinating stories. Let me start with employment. So when we looked at employment, we looked and we measured employment differently from Stats SA's quarterly labor force survey. So what you see in this graph in the green line is the Nutscram data, which is higher than the quarterly labor force survey. And it's higher partly because we start off with higher employment rates in NIDS, and also because in Nutscram, we asked about employment in a particular month. So we asked about February as a pre-pandemic baseline, then about April, which was lockdown level 5, then June, lockdown level 3, October, which was lockdown level 1, January, which was lockdown level 3, and March, which was lockdown level 1 again. And what we found was that there was a little bit of a bounce back in the economy each time we went to lockdown level 1. And we didn't see the same trend in the Stats SA data. And that's partly because in the quarterly labor force survey, not only in South Africa, but around the world, the convention for questionnaire design is to ask about employment in the last week. And they do that over 3 months, so they capture the quarter. And therefore, there would have been multiple lockdown levels in each quarter. And that's why these two trends are so different. So what Nutscram showed us is that when we went into lockdown level 5, there was a hard impact initially, and everybody predicted that. That impact stayed with us even through our initial transition to lockdown level 3. And what that means is that the regulations that were implemented in terms of prohibitions of alcohol and tobacco, as well as the implementation of curfews, had a material impact on the society. But once we relapsed those and we returned to lockdown level 1, there was this response back to nearly pre-pandemic levels. When we went back to lockdown level 3, once again, we saw employment dropping, and back to lockdown level 1 with the economy opening up more, we returned out to our pre-pandemic levels. Now, the importance of this is really to show that government regulations with respect to how we handle a pandemic matters. They matter greatly, and without Nutscram, we wouldn't have seen just how powerfully this impacted employment. To give you an example of what happens if we look longitudinally, in other words, we keep the group of people, the sample of adults who were employed over all 5 waves of Nutscram, we see that here's our pre-pandemic baseline. We have a 54.6% employment rate, but that drops to 37.4%, and 10.4% of employed people go into what we call the state of being furloughed, meaning that the business was prohibited from trading. They retained an employment relationship, but they weren't getting paid, right? So government said, listen, we're going into lockdown level 5, and the business's response was, okay, we are prohibited from trading or we're closing down, but we'll keep an employment relationship. And so we just won't pay you a full salary. And so we saw that that had a big initial impact. Lockdown level 3, that had dropped to half. So many of the businesses were going back, but unfortunately, it still led to some permanent employment losses, right? So this state of furloughed then vacillated again. With lockdown level 1, it dropped. Lockdown level 3, it came back again. And lockdown level 1, it dropped again. So we can see that part of the response of industry to the lockdown levels is directly related to the regulations. And this is the importance of having an independent study like Nutscram to assess what's happening at a socioeconomic level. We were also able to see differences in grant recipiency when these new grants, the UIF Trust and the Social Relief of Distress grant, were implemented. And here, the clear initial impacts that were women were not getting the same receipt of grants as men. And this was subsequently corrected in 2021, but it was a big deal when the pandemic started. We also saw that a lot of people were gaining jobs and losing jobs, and we call this employment churning. So throughout the entire period, because we're tracking the same individuals over time, we can see when they lose jobs and when they gain jobs. And only about 23% of the February employed were no longer employed a year later, whereas about 30% of those without jobs in February 2020 found jobs by March 2021. So this is what we mean by churning. These unstable employment rates, they are showing that people are getting piecemeal or piece rate jobs. Often these were associated with service industries growing, such as growing in the actual mobile delivery of goods. That industry was booming under COVID-19, partly because people were prohibited from moving around physically. So there were these adjustments taking place in the economy, which were quite important for helping to manage the employment levels. We also monitored hunger, and particularly the severity of hunger. So in our questionnaire, with every wave, we asked people, how often do you experience hunger? You can see over time and over all 5 waves, we were able to identify a concept called perpetual hunger, which is that people experience hunger every day or almost every day. We calculated about 1.8 million people experienced hunger almost every day, and about 400,000 children. So this was a major motivation towards the introduction of some of the grants that the Treasury had introduced. And because of things like school feeding schemes stopping because secondary schools and primary schools and ECD centers were also shut down, many kids entered into hunger at a higher rate than seen since really the 1990s. And this graph then shows exactly how that impacted upon our economy. We also asked questions about mental health, and we saw over time exactly what was happening to depressive mood. We were able to correlate that with the issue of what happens with children and adults in food insecure households, and we could show just how hunger was impacting upon the mental health of our communities. And that, again, was something that was showing us a very new picture about the sociology and anthropology of this disease and the impacts to it. We could also see and track people that once they received the grant, what happened to their mental and physical health. Did it actually help them improve their mental and physical health? And there's some excellent papers on the Nutscram website that show us some of these trends. We also asked about vaccines, and we were one of the first nationally representative sample surveys to do so. We could see changes in vaccine acceptance rates between waves 4 and 5, for example, and we had a few excellent papers on this as well. However, what seems to have been the case in the last few months is that respondents are becoming more and more aware of the fact that it's socially sensitive information to respond to vaccine surveys and vaccine questions. So our survey partner that we worked with to actually implement the survey, they told us we need to start becoming more skeptical of response rates on vaccines in late 2021, partly because people realize that they get less flack by saying they're vaccinated, and they are reluctant to disclose that they're not because of the social stigma associated with it. So this is an evolving trend. And again, it takes surveys like the HSRC are doing, like Nutscram. It takes people continuing to monitor the sociology of this particular concept to give us insight about why it is that we see the kinds of response rates that we do. So by the end of Nutscram, we knew that the binding constraint to social and economic recovery was going to be directly correlated to the rate of vaccination. We pushed hard when we presented to the presidency that there needs to be high-level sort of support for vaccination efforts to go into weekends, for them to go into special kinds of initiatives. And we saw higher levels of responsiveness by government to try and do that. And indeed, that all effort should be devoted to overturning vaccine hesitancy through information campaigns, through having key individuals in positions of leadership talking openly about getting the vaccine and these kinds of initiatives. So lastly, in conclusion, I just want to reflect on what were the lessons that we learned, right? That social scientists, through these surveys, for examples, were able to provide our government with, and that was somewhat new. The first was that initially, because this was a global pandemic, all of the emphasis was on epidemiological models. So what do they do? Well, they forecast morbidity and mortality, right? And things like excess deaths, all very important concepts. But in response to that, government took a range of different policy responses. And it started off with the lockdown level 5 regulations. What Nutscram did is it showed that these regulations were too onerous at the time, and therefore that you had to think much more nuanced about the fact that how do we implement restrictions on legal businesses trading. So this was something very important. And this is why you need these social science surveys. You need them because they provide actual data as opposed to projections that epidemiologists will be able to offer. And so it's a joint modeling effort, right? And that's a key thing. The lesson we must take from COVID-19 is that with future pandemics, and everybody's telling us that there will be more of these more often, we will in fact need to be able to do so and have multidisciplinary modeling to understand the response. The second thing is that rapid critical insights from sample surveys are also in fact needed. Now, once you go into a type of rapid modality for assessing social data, you have the potential to create many mistakes. And as a consequence, you need to be very aware of the trade-offs of moving fast. So some of these often have to do with degree of representativity you have and so on, but this is where dialogue with Stats SA is so crucial and why the NPDO has been such a valuable process to participate. So we're well equipped to do this going forward and to learn from the past. And the final point is that Nutscram was funded by the private sector, and that's all great. However, as part of government planning for future responses, reserve funding should be kept aside to be able to sponsor some critical surveys, such as rapid mobile surveys, and to have independent evaluations by social scientists. And the reason you want these independent evaluations is because it just provides a sort of less politicized view and group of people who can kind of say, this is happening, this is good, this is bad, and provide some objective feedback. So those would be my take-home points. Thank you very much. That's it from me.
Thank you, Riza, for that additional view on things. Thanks. The next presenter is Prof. Julian May. He's from the Center of Excellence in Food Security at the University of the Western Cape. Thanks, Julian, sharing some light on the issues of food security. Can the people who want to ask some questions, please post that in the chat. Prof. Likeness and Erica Kramer will look at those later on. Thank you, Julian. You go for it.
Thank you very much, Chair. And thank you.
You've got 10 minutes, Julian.
Thank you very much, Chair. And thank you very much for inviting me to this presentation. I'm really looking forward to the discussion that we'll have later. I'm going to focus the topic now on addressing the slow violence of child malnutrition during pandemic. Why slow violence? Because here we're talking about changes which are often not observed, but which are damaging over a life cycle and which are damaging to a society. Slow violence itself is a concept that comes from the literature on climate change, and here we're applying it specifically to children. So as the first Center of Excellence to present, I'm going to take a little bit of an opportunity to just say, what are the Centers of Excellence for those who don't know? The Department of Science and Innovation and the National Research Foundation have been investing in Centers of Excellence in South Africa for more than 20 years. There are 16 or so centers established, and today you have presentations from two of the most recently established, the Center of Excellence in Food Security, and later my colleague Shane Norris on the Center of Excellence in Human Development. The NRF has its own definition of Centers of Excellence, but this is the one which we certainly subscribe to in the Center of Excellence in Food Security, and I suspect Shane also has much the same idea, that the purpose of a Center of Excellence is not just to publish more or to graduate more, but to be able to create new frameworks to bring about changes in the field of study, to think about building models of implementation and take leadership for innovation, and to ensure that the research results in impact, providing the structures and the ways in which we are able to transfer information to other contexts. So that is what I would think a Center of Excellence offers to the national science infrastructure. This particular Food Center of Excellence is hosted at the University of the Western Cape and co-hosted with the University of Pretoria. But it in fact comprises 26 institutions across South Africa, Africa and beyond, including most of the universities, most of the science councils, and a range of NGOs as well. The structures there, I won't take you through the structure other than to draw your attention to the right-hand side where our work is undertaken through 3 research programs, 1 on governance, 1 on technological innovation, 1 on health, nutrition, health and safety. In other words, this means that this center works across the natural and social sciences as well as the humanities. At the top there, you'll see some of our allies in critical food studies and an entirely humanities-led initiative from the UWC, UP, and the University of KwaZulu-Natal, one of the Africa Research University Association Centers of Excellence in Food Systems at UP, and a UNESCO chair in African food systems. So that broadly then is what the Center of Excellence looks like. Our focus then is what we've termed over the years the South African food paradox. How is it that South Africa, although an upper middle income country with a positive food balance, with a globally competitive science and innovation system and sophisticated policies with many support programs, has such poor food system outcomes? These include a poor nutrition record, a deteriorating natural environment, strong inequalities within our value chains, strong territorial imbalances between the different parts of South Africa, and the concern of massive unemployment and the marginalization of our rural areas. I'm going to be focusing particularly in this presentation on the first of these, the nutrition record, and particularly the nutrition record for our children. To address that paradox, in 2016, the Center of Excellence launched a new program trying to understand the causes of child malnutrition and ways in which it can be reduced. It was launched with a multi-stakeholder inception meeting. In other words, right at the beginning, we involved researchers, government, private sector, society, and perhaps less civil society in terms of colleagues from the activist sector. We invested about 8.5 million Rand from the NRF grant that we received and as well as from other sources. And we involved a wide variety of institutions. UWC, you see them all there. And you'll note that the MLC and our colleagues in the HSRC are also involved, as well as 2 universities overseas. We used the grant to support 13 postgraduate students and 2 postdoctoral fellows, and ultimately published 30 articles and book chapters. What this means is that we were ready to make a contribution in 2020. We had already done most of the research, and we were ready now to look at that research through the lens of the pandemic. It culminated in the launch of the Child Gauge 2020, which took place in February 2021, and an ongoing policy engagement that started in January 2021 and has proceeded throughout the year as we've tried to convey the message of what we found to decision makers. What really is the bottom line? What is the thing that we're concerned about? It comes down to these 2 graphs, really. On the one hand, the fact that we have, and on the graph on the left, the orange bars show the prevalence of under 5 stunting in South Africa from 1993, from the very first surveys that gathered this data, through to the most recent surveys, in particular the Demographic and Health Survey. Although the graphs show variations, ultimately, if you take into account the confidence intervals and look at the data more carefully, ultimately child stunting is essentially flatlined. We've made no progress. But if you look at the blue line, that's our investment in the child support grant. Introduced in 1998, that graph shows a rapid increase in one of the largest programs, certainly the largest in Africa, of cash transfers to children. I could show you other graphs about the other interventions that we've undertaken to be able to deal with child malnutrition. We've adopted pretty much the same strategies as countries such as Brazil or Peru, who have actually been able to bring down their child malnutrition, while ours has remained stubbornly high. The right hand shows what we're concerned about. And I think previous colleagues have already mentioned the measurements of hunger that they've been undertaking through the different surveys that were implemented during the period of the pandemic. So there we have graphs representing different aspects of food insecurity, undernourishment, self-reported hunger, adult obesity, and anemia. And in each instance, we see a steady rising after a decline during the 1990s and 2000s, this little spike down there, which is the impact of our COVID. So that then is our concern. We have the largest social protection system in Africa, but we continue to have a high prevalence of stunting. To convey that message, to convey all of the work that had been undertaken, we partnered with the South African Child Gauge at the University of Cape Town. The Child Gauge has a long and proud tradition of presenting scientific research to a broad community and then ensuring that that information is disseminated through appropriate science communication. The Child Gauge 2020 comprised 60 contributors, 18 institutions, and in the line in preparation for this webinar, I looked at the number of disciplines and came up that we had 29 disciplines, ranging from different humanities, anthropology, critical food studies, through to the social sciences and psychology, and psychiatry. We looked at law, we looked at social security, and into the natural sciences, looking at medicine and dietetics. These researchers drew on all of the surveys that we've been speaking about, the NIDS, the Nutscram, as well as administrative data, communities of practice meetings in which involved working with stakeholders from all parts of society. A curiosity, I think many of us have agreed about, that COVID allowed us to reach far more people with our science communication through the existence of the online webinars that we were able to conduct. We looked at administrative data, food dialogues, which again involved film, and as was mentioned right at the beginning of today's presentation, we looked at some of the storytelling that took place.
2 minutes, Julian.
Thank you. What specifically was the impact of COVID-19 on children? Well, here's the list: the closure of schools, some of these things already mentioned, the restrictions on informal street hawkers from which people got food, the rise in child hunger, and to do primary health care, to take part in pre and postnatal care. Ultimately, the Lancet predicts a 14% increase in wasting will result from COVID. How did we do this? Well, a very active campaign of science communication. You'll see the different presentations that we gave. The launch was undertaken by the First Lady of South Africa. We continued to publish in different forms of communication and to engage with policy fora wherever we could find them. We tried to bring out the message of stunting, the issues of sugary snacks and the role of our tax, looking at the human rights aspect, the rise of food prices, and ultimately the issue of how COVID-19 had exacerbated hunger among South Africa's children. There's an ongoing series of policy and science engagements. There's a list there. It includes this ministerial indaba and even an interactive play, which was ultimately designed by food scientists and food safety scientists at the University of Pretoria. And you'll see the link there, The Curious Calamities of Anti-COVID. The bottom line of our message: put children at the heart of the food system. We have a number of specific interventions that we propose and that we continually talk about, but this is the bottom line. Children need to be at the heart of our food system. And I'll conclude with one word. The first is imagine. Imagine had the South Africa not invested in the different platforms that were drawn on for the Child Gauge, the NIDS, the different surveys that were undertaken, the building of the Center of Excellence. What if we'd gone into COVID blind? And what would have been the implication? The next, imagine had we invested, imagine had we had better information and been able to react faster and more precisely. And that really is something we need to think about as we grapple with the shortage of funds and where cuts need to be made. But imagine had we imagine if we had invested more money to be able to do things. And then lastly, imagine if 100% of Africans' children were properly nourished and properly fed. Imagine what our future could hold then. Thank you.
Thanks, Julian. Very important issue. At the start of COVID, we had some cases of kwashiorkor being at the Baragwana hospital. So very critical that we look at this at the moment. Our next presenter is Prof. Shane Norris. He's from the Center of Excellence in Human Development. And he's going to look at early childhood development and the quality of life. Thanks, Shane. You're on.
Thank you very much, distinguished colleagues and Chair, and the invitation to present. Just want to get my things open here.
You've got 10 minutes, Shane.
Perfect. Thank you very much. Thank you very much, Julian, for setting the scene around the Centers of Excellence and the work around the child gauge and child malnutrition. So in my presentation, I just really want to kind of, as Julian mentioned, the Center of Excellence is really a hub and spoke model. There's work done within the center, but we rely heavily on the 26 institutions that we are aligned with across the country. And so as an effort to engage humanities in the research endeavor around COVID, the Center of Excellence in Human Development initiated several funding opportunities to support research across our network. And today I'm just going to really just give you some of the highlights that are emerging from this work that the COE has supported. So the Center of Excellence in Human Development around COVID, we really focus on two main areas, behaviors and impact. And I'll start with the behaviors and some of the initiatives that has gone forward in this area and some of the results that are emerging. So in terms of behaviors, we established a think tank to really examine in more detail country action plans and behavior change interventions. So this is thinking much more on behavior change from a national perspective. We examined some health service, particularly maternal and child health services, and then lifestyle, focusing particularly on alcohol, tobacco use, and physical activity. And a national survey is just recently completed around this. And unfortunately, I don't have the results yet, but that will be forthcoming in the new year. So switching over to the think tank, this was a really exciting exercise. It's still ongoing, but producing some interesting insights. It's a think tank of behavior change specialists from across the country in different fields of speciality. And the first undertaking of the think tank was to understand how do countries react in a time like COVID. And we were interested that there was some movement in what's called behavior change action plans, and that only a few countries, so in fact only four countries, the EU bloc and in the US, so again, other than India, high-income countries mainly, have actually developed a fully worked out national behavior change action plan in a time of a pandemic. India went a bit further in they also augmented a very specific COVID-19 communication plan. And we're currently reviewing all the evidence around COVID-19 behavior change interventions and the success thereof and synthesizing that into a systematic review. So that's kind of set the scene to kind of how we can think about augmenting our evidence to support a national behavior change action plan. Communication, as we've all heard in the various presentations and certainly from data in the COE, behavior change interventions, communication is quite linked. The trust of sources varies, and here you can see from a national study across age groups that there's various perceptions around trusted sources around COVID-19. Clearly, the news media and government are the two critical elements. Interesting for us in the older ages, the kind of social media peaked a little bit higher than government communications. We've had some communication experts trailing the discussions around communication and data coming from that. It's clearly that communication is pivotal in a national response to a pandemic. And in some ways, we've done very well, and in other ways, less so. Clearly, mixed messaging is quite a stumbling block, particularly when you have experts both nationally and internationally derail public perception of what's the truth. And unfortunately, in 2020 with Trump, that even though Trump was in the US, you would be surprised of how many South Africans were influenced by what was being said in the US. So mixed messaging, both from experts, community leaders, and others, is quite critical. On a positive front, data that's emerged around the family meetings with the president has been incredibly effective, reassuring, credible, decisive. And again, that's like a good example of leadership that galvanizes information, communicates it clearly, and creates that reassurance and credibility. Myths abound, and a critical aspect of any national plan during a pandemic is how to counter these myths, but very quickly, because they get root and can impact, as we see in vaccine hesitancy. Just before vaccines were rolled out to the general public in South Africa, we conducted a national survey. And here you can get a sense, and this is stratified by socioeconomic status, that in the red is not at all or not sure. This is just, as I say, reminder just before rollout. And here, so we have a large proportion of individuals that were hesitant, and particularly the gradient between low socioeconomic status to high socioeconomic status. Now switching over to another dimension, and this kind of feeds into what Julian was saying, is that there are multiple factors that influence child malnutrition. One alarming area of data that's emerging from the work we're doing is the impact of COVID directly and indirectly around women's access of maternal and child health services. So in a cohort study, we now have evidence to show that women are presenting later for their first visit at the antenatal clinic. They are having less antenatal clinic visits despite really good pre-pandemic data, which indicated excellent use of antenatal services in urban South Africa. Another alarming component is 10% of the women in this cohort terminated their pregnancy. And in their counseling, qualitative sessions, COVID reasons, be it direct or indirect, featured prominently. And there's a hesitancy to visit baby wellness clinics. So again, the kind of notion of the virus, risk of infection, vulnerability, impact of the COVID economically and otherwise, is changing behavior in many other ways than just what we are immediately observing in terms of either vaccine uptake, etc. And this is an important part to understand that the pervasiveness of the pandemic is going to have a multiple array of effects on behavior and consequences of those changes in behaviors. Switching to impact, part of the impact of COVID was really to try and look at well-being, mental health, and violence in particular, food security, child growth.
2 minutes, Shane.
Perfect. As Julian mentioned, and livelihoods. So this is just to share some qualitative data from scientists that worked particularly during the lockdown. So this was a series of qualitative work that they managed to execute during the lockdowns in 2020. And so that's a useful kind of baseline qualitative insight, because obviously we've gone through several waves and now into wave 4, and time is important. Timing of when data is collected is important. But clearly, as we've heard, the impact on livelihoods and mental health during lockdowns and the pandemic has been quite significant and pervasive. Also violence. I mean, we saw last year, and government was quick to react and initiate communication efforts and other interventions. But we did see spike in violence, and this was certainly portrayed through the various qualitative discussions, and particularly even perspectives from men in response to violence and abuse during this period. So just to conclude, the process of the past 18 months of the work that we've been doing has really given us some really useful insights. One, aspects cannot be just as they've been. We cannot be business as usual. Colleagues have mentioned, and certainly just to reiterate, that the social scientists, humanities, we need to be able to become more expedient from data collection, analysis to dissemination. We've got some excellent examples of where longitudinal quantitative studies are absolutely essential, but also to argue longitudinal qualitative studies are also just as important. We need to be better prepared, and partnering with government in the process we've been doing now is a brilliant start and should continue to ensure we have alignment and preparedness for potentially the next pandemic. A critical element is that what's amazing of the session, if you just hear the presentations, the incredible platforms we have at our disposal is phenomenal. And as Julian said, that kind of investment in these initiatives is something we need to really gain more from, and potentially a greater coordinated, galvanized approach to all this infrastructure in future endeavors may be something that can exponentially add value. We already seen that on the kind of trial site level, there's huge movement to be able to create multiple trial sites where they can be reactive, coordinate trials, get data out very quickly. We need to be thinking in the same way for social science infrastructure. And then just lastly, it doesn't matter what you're looking at, be it quantitative data, survey data over time, or qualitative, there's been profound impact. And part of where I think social scientists can really help is how do we start looking at recovery solutions and potentially shifting our focus to recovery and feeding that evidence and insight back in through these channels like this seminar, I think would be really useful. Thank you.
Thank you very much, Shane. Thanks for those insights. Next on, we're going to have Himla Sodial. Prof. Himla Sodial is from ASAF, which is the Academy of Science of South Africa. And she's going to look at ASAF's response to COVID. Thanks, Himla. Are you ready? Himla, you've got 10 minutes.
Greetings, Chair. Is my presentation visible?
Yes, I can see it. It's very clear. Thanks.
Wonderful. All protocol observed. Greetings, colleagues. It's been an absolute pleasure to be asked to be part and parcel of this. I want to specifically extend a word of thanks to Dr. Segrin Mudley and Danny Adams from Program 4 of the DSI for including ASAF in this National Policy Data Observatory. Since we've been part of it, it's just been a phenomenal journey. And what I want to say at the outset before I lose my time is that ASAF takes the word science in the Academy of Science very holistically and inclusive. We include both the natural sciences, the social sciences, and humanities. And I'm rather irritated by this persistent two-culture kind of behavior that we have in the country. And it's not just us, it's worldwide, where we kind of create these silos between the two streams. Chairperson, I'm going to use this structure that looks like a transformer that's been generated to highlight a few issues that I've picked out in keeping with the topic of our COVID response from a perspective of social sciences and humanities. And before I forget, I just want to share with the audience that in the last financial year, we hosted 59 webinars, given that we are working virtually, on various topics that spoke primarily on the COVID issues. And from April to November this year, we have now hosted 58. This year alone, we have generated some 53 million rand of average score gauge based on our output. And we have had an outreach of close to 55 million. I think that is phenomenal given the challenging times that we live in. So coming to some of the projects, and I'm going to go through these very quickly, in the bracket of poverty alleviation and inequalities, in conjunction with other partners, ASAF hosted 3 very, very critical webinars on the one that dealt with what do we do to reduce poverty and inequality, the second one on how to fund interventions to reduce poverty, And the third one was, what must be done if the state is to be capable of poverty and inequality reduction? And Julian May, who's the chair for our standing committee on the science for the reduction of poverty and equality, is on this webinar. So Julian's group kind of took this forward. I want to emphasize that ASAP did this in partnership with the other experts like the Study for Poverty and Inequality Institute, the Bureau of Economic Research, and Sarchi Chair, Social Policy at the University of South Africa. It may not be possible for me to go through all the discussions, but what I want to quickly share with you are some of the people who were involved in it and some of the key messages. So for example, what do we do to reduce poverty and inequality? The key message was that cash transfers directly reduce hunger and improve the well-being of recipients, with the child support grant and the old age pension being the most targeted. We've heard already that women, however, receive less emergency support despite being worse affected by the COVID pandemic and taking on the burden of care. Similarly, when it came to how to fund interventions to reduce poverty, this was really a fantastic and dynamic session moderated by Judge Dennis Davis, who we all know from ENCA on TV. And some of the messages here was that South Africa has limited fiscal space available, which is a direct result of poor economic performance and poor governance at all spheres of government and the state-owned enterprises. Nonetheless, the state cannot hide behind this constraint, as large poverty alleviation programs are needed. We have the Department of Revenue also on this as part of the partnership, so I'm sure they are aware of what needs to be done in this respect. And similarly, what must be done if the state is to be capable of poverty and inequality reduction? There were a few outcomes from here, like there is a need for fundamental rethink of regulation of the regulatory environment in which public servants operate to foster the innovation and rapid response needed to alleviate poverty. I'm not going to read through all of this, Chair, but I also wanted to add that after ASAP hosted these 3 series, the HSRC also had similar sorts of topic. And I would say to Professor Simbai, who's on the line, that perhaps ASAP and the HSRC should get together and exchange notes, and perhaps we could consolidate what we learned from these exercises and present this as a report to the relevant stakeholders. Chairperson, we have a very strong outreach with respect to science engagement and communication. And we have tried to promote, the presidential employment stimulus package. We have a very strong focus on advancing young scientists through the South African Young Academy of Science. We have worked with the DSI and launching the national rollout of the Municipal Innovation Maturity Index. And we've also had engagements with other embassies and stakeholders speaking on the COVID pandemic, and not forgetting, of course, our commitment to the SDGs, which we have to deliver by 2030. Similarly, around this, we note from our earlier discussion around the involvement of religious leaders. In September, in keeping with our cultural heritage celebrations, we invited different representatives from the Hindu culture, the Muslim and the Christian representation to talk about what was the impact of the COVID pandemic in terms of the rituals people performed related to death, to marriage, to all other kinds of things. We all know what implications we have had to undergo through the lockdown regulations. Similarly, we've heard a little bit about gender-related issues, and once again, the ugly head of gender-based violence, which is constantly in our psyche. And as we now go through these 16 days of activism, we are all aware of it. But it also, ASAP also took this on during National Science Week, bringing together representatives from media, private sector, young scientists, and others, and civil society to deliberate on these issues. And it's very sad, Chair, that no matter how much we try to do from academia, this is still on the rise, and we are all aware of national initiatives to try to curb this as well. So there's a lot to be done in this area. ASAP participated at the COP26 meeting summit in Glasgow. We hosted a side event and other sorts of activities. And I also wanted to add that we all published our second report on
2 minutes, Himla.
On science and tech, on the climate change initiative as well. We've got a strong commitment to working with the South African Local Government Association, and this is in the sphere of science, social policy, and legal harmonization. And we believe that this partnership could lead to us having a bigger impact on the district development model. And so we're working very, very hard to ensure that this happens. With monies that we receive from the National Academy of Science, we have had a very important role to play in contributing to dissemination of policy briefs, particularly with non-pharmaceuticals in the SADC region, and these are the countries that we participated with. At an international level, ASAP participates in the Science 20, the Commonwealth arena, with other academies, and as you can see, some ASAP members have contributed in having a footprint of ASAP's role in contributing to the pandemic at an international status as well. Last but not least, I want to focus on our publications done in our scholarly publication area. The South African Journal of Science has featured various articles, and in fact, we also had a supplement with a strong focus on the social sciences and humanities. And for next year, we have a special issue for research articles on COVID-19 from a multidisciplinary perspective. But the project that I'm most impressed with, and Chair, I want to emphasize this, ASAP put together a booklet on the COVID pandemic, inviting many, many participants. And this one alone has generated had an outreach of over 13 million and generated about 17 million rand of income, through advertising. So these are some of the things that we have done. And I hope that I've given you a glimpse of what the ASAP footprint is like. And sorry that I had to rush. I think as my colleague said, next to Lewis Hamilton and Max Verstappen, I would win the next Formula One. Thank you, Chair.
Thanks, Himla. And thanks for the role that ASAP plays in collaborating and bringing all these distinguished role players together. Really appreciate it. Okay, so next up we've got Priscilla, Prof. Priscilla Reddy from HSRC, not HSRC anymore, the University of KwaZulu-Natal now. Priscilla, are you ready? And looking at reflections on the socio-behavioral responses to COVID, a human approach.
Yes, thank you.
Are you going to try to share? Or?
I think maybe not. I'm trying, and it's as we predicted, it's not happening. So could you share?
Okay, let me go for it. Okay, can you see your presentation?
Yes, I can. Thank you.
Okay, you've got 10 minutes, Priscilla.
Thank you, Ashwell. Good morning, everybody, and thank you very much for inviting me to present at this prestigious forum. I'd like to acknowledge the DG, the Deputy Minister of Health and all Deputy Minister Education and all protocol observed. Thank you. Next slide. As we know, this epidemic has brought to the front behavior change in a very, very difficult and complex manner. And what we all know from our personal lives and generally is that behavior change at best is very difficult. But what COVID-19 needed was multiple behavior changes, and this was wrapped in fear, mistrust, loss, grief, loss of freedom, and very importantly, as we've repeatedly heard, severe economic hardship for many of our colleagues. And this is really a time, and I'm going to use this time to reflect on what we set out to do and what we did manage to achieve. Next slide, please. We need to acknowledge and appreciate all the work that's been done with respect to the epidemiology and the biomedical aspects of this disease. Socio-behavioral research was undertaken by the HSRC from the outset and informed some of the country's early responses in the fight against the pandemic. And what I want to say here is thank you to the DSI, the DG, and others in particular for actually realizing the importance of social science research and its application and brought us in from the outset. However, some of it has had limitations. We now need to engage in a reflection and look at our successes, our limitations, our failures, and ongoing challenges. And how do we compare across the continent and what can we learn? At this time, I'd also like to say congratulations to the National Observatory. I think a phenomenal amount has been achieved in a very, very small time. And in a sense, it's unprecedented. Next slide, please. When we started our work, we started with the philosophy and with the theme, and that was that communities are at the heart of any disease or any emergency response. And this approach underpinned all the work we do, because this epidemic was playing out where people lived, where people worked, where they played, where they traveled, and where they prayed. And so it was really critical for us to understand what the people in the communities were saying. So data was gathered over a period of the pandemic. And as we know, at the time when we were doing this work, we were using this data and we were translating it largely for policymakers. And I think that was really important and relevant at the time. However, I think the application of social science research and data collection needs to be re-examined, because we need to look at how we translate the social science data collection to form rigorous health, social, and behavior change, educational interventions, and general health promotion interventions. We need to provide detailed data on determinants towards preventive behaviors, such as behaviors linked to vaccination campaigns, so that we confront the reluctance and thereby deal with hesitance to accept the vaccine, hesitance or accepting the vaccine. We need to provide data for specific outcomes, for example, vaccine uptake, mask utilization, and other preventive behaviors, which are as important as the vaccine acceptance behavior. We need to inform specific targeted media campaigns against all types of misinformation, including social media, which has become a major player the world over. So, for example, we need to harness skills from trusted people, like the HSRC did in its early counter strategy against misinformation, where we got people like Sia Kolisi to provide a positive message and to encourage people, to encourage fans and supporters. We also need to use methodologies that ensure data for intervention development are multilingual and linguistically appropriate. And I think this is really, really important. And we need to ask questions about whether this was used in developing interventions, be they behavior change interventions, communication interventions, or other interventions. Next slide, please. Again, we looked at approaching and understanding COVID and human behavior, and we took this whole life approach. Why is this important? This is important because a context-specific health and well-being framework is necessary at an individual level, at a family, community level, at a society at large level. And this is required because we need to look at how social science research and social science data will contribute to primary prevention, early detection, and patient care levels, as well as the long-term mitigation of the impact of this pandemic. And I want to emphasize here that different sets of data are necessary for a preventive intervention, a treatment intervention, a care intervention, a health and promotion intervention, a rehabilitative intervention, or a bereavement intervention. What is critical is that behavior change research has to employ a theoretically grounded framework. Without understanding the social determinants of each of these problems or behaviors is going to result in limited success with intervention, implementation, and development. Just to mention a few theories that one can use are social cognitive theory, chaos theory, health belief model, and these theories help us understand the determinants of these behaviors and problems. And it's really important to engage with these theories in all the data collection structures that we develop. Next slide, please. Again here, we can come up with several strategies, and these are historic strategies, nothing new about these strategies, but the way social science research approaches these strategies in order to develop interventions at different levels is critical, because otherwise you get the wrong intervention for the wrong level, and you have to wonder why it doesn't work. Next slide, please. Again here, I'm looking at the issue of translating data for not necessarily just policy, but for program and intervention development and implementation science. So at the HSRC, when I was there, we did several surveys, and the one survey, the most recent one, was the 1 year later survey, and it collected data on a number of determinants and behaviors. So I just chose one because it's relevant and important, and we looked at some of the determinants, which I'm not presenting here in the interests of time, around vaccine behavior. We see here that 75% had indicated that they would take the vaccine. However, intention to be vaccinated was much lower among the youth and people who did not think vaccines were a good way to protect communities from disease. This needs to be explored in detail. Significantly more 18 to 29-year-olds than 30 to 69-year-olds were unsure if vaccines were a good way to protect the communities from the impact of this disease. But why is this important? It's not just about surveillance, social epidemiology, and collecting data. I think the Observatory's next challenge would probably be to look at a component of implementation science, because the data is being translated for policy, but I think we need to drill down to that detail and look at how we develop these interventions that are targeted, that are strategic, that are focused, culturally and linguistically relevant. Because we want to improve knowledge, we want to make sure that we can change those changeable determinants, and we need consistent research to analyze and look at how we redo this. Next slide, please.
2 minutes, Priscilla.
Sure, next slide, please. And again, I think in my presentation, I would argue that this is probably the most important slide of all. And this is actually looking at how do we translate the socio-behavioral data, the determinants, into interventions. And I'm just giving a very quick example here. If we look at low vaccine coverage and high COVID-19 cases, what is the targeted behavior for which aid group? Vaccine seeking and acceptance. And again here, without an understanding, a detailed understanding of all these determinants, we're not going to develop interventions that make a difference. And finally, in the implementation science aspect of it, social science and behavioral science data is critical to assess the success, partial success, or even failure. Next slide, please. Lessons learned, time for reflection again. As we know that outbreak control and management of pandemics needs to be pivoted on a philosophy of working for the common good. And I don't think we can work for the common good in single silos. I think what we need are multidisciplinary teams, not only for the research component, but for the implementation and development science component as well. The results show that the socio-behavioral data has to be fed into the country's response right from the beginning. And I know the DSI and our minister really worked very, very hard in encouraging this and having the early insights to realizing this. A system for behavioral and social sciences has to be put into place so that scientists can work in complementing both the biomedical and the epidemiological data collection. What usually happens is the modeling work is seen up front, and this is usually the epidemiology, but that needs to be translated into an interaction between social sciences, governing bodies, and other stakeholders. We need to look at creative methods and smart partnerships in order to collect and triangulate data, be it social media type data, qualitative data, or quantitative data, to ensure that rapid response that's often needed. Biomedical data that's released without socio-behavioral data and the context in which it's collected can cause severe problems, such as the travel restrictions that followed the release of the recent variant, albeit the reactions being knee-jerk from other countries. That's actually what happened. We need to strengthen social science research in South Africa to coordinate the country's behavioral responses. And we need a strong system of infrastructure and working together. We need to build these multidisciplinary teams like other countries have done, as we've heard before, but this time has to focus on how we translate and transfer the social and behavioral data that we collect to intervention development. We have done this before. We've got some experience. If we look at Ebola and how we assisted there, we also need to work with other partnerships like the African CDC and a pan-continental approach. As I said earlier, social scientists need to be integrated into these partners from the outset. Thank you. Thanks, Ashwin.
Thanks, Priscilla. Thanks for that. Thanks for keeping to the time. I'm now going to hand over to, I think, like Prof. Likeness Sambayo would start this off, and then Prof. Erika Kramer-Mbula will then also help facilitate the questions and answers. Welcome, Likeness. You are clear there.
Thank you so much, Ashwa. To start with, I wish to greet the Deputy Minister, Manamira, the DG, Dr. Mpara, and the Statistician General, and all protocols observed. Thank you to all the panelists for your presentations. Professor Erika Kramer-Mbula and I have been tasked with conveying questions which are asked by the audience to you. So we'll be taking turns posing these questions and or comments. To start with, I wish to mention that we've only received a few comments so far. Perhaps they are beginning to stream in, but please do submit your comments to the public questions monitor so that they can be passed on to us. To kick off, the first comment came from Yuchen Wang, and it's really a comment and something that's in agreement with what particularly DG Dr. Mjwala always says, which is to try to promote the transdisciplinary research where we combine social and natural sciences and all other sciences, including engineering. Yuchen Wang said we need to combine social and natural science plus engineering together. I think we all agree with that. but perhaps the panelists might just want to comment if there are specific examples that could be relevant. But the first question was posed by Ricky, who asked, how common is religion used as a reason for individuals not wanting to take the vaccine? Please, you can go ahead and answer this question, the panelists. We can start with Ben, who provided a written comment in the chat, which the audience can't see, and then others can follow. Thank you.
Thank you, Professor Simbai, and thanks for the question, Ricky. We did actually look particularly from our round 4 data set, which was administered in June, July. We looked particularly at the issue around religious objection as a basis for vaccine hesitancy. It did occur, but it's only mentioned by a fairly nominal share of the public. In total, 2% made explicit reference to some form of religious objection as the underlying basis for their hesitancy. So it's a very small share that actually do say that is the primary motive behind not wanting to take the COVID vaccination. In addition to that, we also, in the same round, looked at whether vaccine hesitancy increases with as the depth of self-reported religiosity increases. So the more religious you profess to be, that sense of depth of religiosity, does it translate into greater hesitancy or not? And the answer is there's a very, very minor effect. We do see a slight gradient as respondents report greater depth of religious sentiment, but it's really small in size. So thank you, Professor Simbai. That's my response to the question from Ricky.
Yep. Could others also attempt to answer the question from the evidence that they have? I saw both actually Priscilla and I thought Julian also might have mentioned something about religion. Any takers?
Like this, it's Mark here. Hello.
Sure, please go ahead.
On the first issue of interdisciplinarity, it's so vital, and I also really support that, but I'm reminded of a saying that says society has difficulties, but universities have faculties. And so the importance to see these things all together is very vital, and we must do that. On religion, we haven't found that as a major part of the decline of the hesitancy in saccharin data. But as Ben said, it was small then, so we saw even less than 2% on that.
Okay, thanks. We'll move on to Erica.
Good morning. I hope you can all see me.
I think Erica just moved closer to the camera.
All right. I'm not sure it is working, but let me change the background. Can you see me now?
Now we can see you clearly. Thank you.
Great, excellent. Thank you so much, everybody, for the great presentations. It's been fascinating to hear and very encouraging, actually, to see the variety and the diversity of and the excellent data sets that we have available for decision making. There have been a number of questions that I want to, many comments that I want to put forward to the panel, or to the panelists. We know the importance of evidence, but it is also important to reflect on the ways in which users make sense of that evidence. And from the beginning of the pandemic, we've heard contradictory claims and often conflicting views about various aspects related to the pandemic, including the effectiveness of wearing a mask, of the effectiveness of different vaccinations. Hesitancy has been often driven by a misunderstanding or insufficient understanding of how to treat the symptoms and their severity. So there's been some comments posed by Chris. There's a question asked about concrete information about how to treat vaccinated people from the new variant. And I think I will perhaps ask Narnia to address that question if possible, or any other panelist. But I would like to also pose together with that question the broader issue of conflicting views and contradictory evidence, and how do we tackle that in the context of multidisciplinarity?
Sorry, was that question posed to me?
Yes. I mean, I'm inviting you to maybe reflect on the question. It's a very concrete question on how to treat the symptoms of the new variants on vaccinated people, but also, if you would like to also reflect on this issue of conflicting views and contradictory views and misunderstandings that may emerge from that on the use of evidence.
Okay, thanks. Well, I can't make any comments from a medical perspective or a natural science perspective, but I think that we need to recognize that society and democracy is quite messy, and there will always be contradictory and conflicting views on things. But in certain circumstances, we also need to ensure that whilst these exist, science should take the front and center. So there are many cultural views, religious views, individual views of what is happening in terms of the pandemic, as well as in particular vaccine mandates. But I think this morning has proven that it's important to put science, natural science, human sciences, and social sciences at the forefront of these discussions, so that we can get facts out there and perhaps change minds if minds are open to change.
Thanks, Narnia, for that. We have a couple of hands up from panelists, Priscilla and Julian. Priscilla, please go ahead.
Thank you. Yeah, I think I want to respond to with the conflicting views part of the question. There's several approaches to conflicting views. But from the kind of social science perspective, I think again, first of all, it's necessary to build research capacity among people from different communities and different backgrounds, because it's only those people that will be able to access communities in a way to understand the determinants of the conflicting views. And I think, when we're developing interventions, we have a huge competition out there. We have a multi-billion-dollar media industry that is harnessed by people that are paid to put across these conflicting views. And creating conflicting views is not an innocent game. It is a means to an end. And I think any science has to approach the data collection in a sophisticated way. Looking at theories, looking at community context is absolutely critical. So first of all, build the right capacity to collect the right kind of data within a community context, and perhaps in the languages of where people come from. That's just the start of the response, but I don't want to hog the floor. Thank you.
Excellent points. Thanks, thanks, Priscilla. Julian, would you like to go next?
Thank you very much. And I apologize for the grinding behind me, but there's renovation taking place in the house next door, so I can't do anything about it. I want to pick up on that point about contradictory evidence. And it arose as many people do. You stare at your social media, your Facebook account, and you see something which someone posts about experts have found. And I'm afraid this tends to be a red rag to a bull to me, because when I see experts found, and I wonder who were the experts, what did they find? And in trying to pursue that, I started reading a literature which is why do people believe myths? Why is pseudoscience so convincing? And perhaps that's where we need to be focusing some of our research, to actually try and understand what it is about what we do, which makes it difficult for others to understand, people who are not used to our language. And let's just think about some of the presentations we've heard this morning. As social scientists, we very rarely say we found something. We probably found something. The probability is, the confidence intervals are. The statistical difference is maybe. It's a language which is actually quite difficult for a general public to understand, because we qualify what we find. We also tend not to find things. We most often don't find something out. We more likely are to find that something doesn't happen. It's the nature of hypothesis building. You rule out things that you don't know, and you slowly find out what you might know. So I think a lot of this is a better understanding of science communication. I think it's better understanding of why people believe things, and what are, whether it's cultural or religious, what are the factors that result in people believing a particular message. Is as we read now more and more, when we are reading science communication, use of the anecdote. It's very easy for people to accept a story which starts, my uncle had a friend who had a negative reaction to a vaccination. So much more convincing than there's a 99.9% probability that there's nothing wrong with that a vaccination will not lead to an adverse effect. And those are the things I think we need to look for. So maybe my appeal is elevating science communication, perhaps almost to the level of a field of study or a discipline, but it's not just about someone helping us to communicate. It's about understanding how we're understood. Thank you.
Excellent points. Excellent points, Julian. Ben, your hand is up.
Yeah, thanks, Erica. I'd just like to comment on one aspect which hasn't been touched on much in the previous comments, and that's actually where we produce contradictory evidence amongst the academic infrastructures, and how we deal with that apparent paradox. And I think the one example that I want to just touch on very briefly that relates to the vaccine hesitancy is Nutscram, the UJH, SRC, SAPRIN, and others were finding vaccine hesitancy figures in the low to mid 70s range. And Afrobarometer came out with a figure that acceptance was not in the 70% range, but was actually 43%. So we were all left kind of a little flawed by that and thinking, well, what might account for that discrepancy? And it obviously gained a lot of traction because it was quite sensational to say, wow, it's actually 30% lower than what we thought it was. And so we had to engage with Afrobarometer and really look at the methodology. And what we actually found is it had something to do with the formulation of the question, and that they had asked the question, if a vaccine for COVID-19 becomes available and the government says it's safe, how likely are you to get vaccinated? So that phrase, and the government says it's safe, was what we started looking more at. And when we actually looked to our data and said, what is hesitance, what is levels of acceptance of the vaccine like amongst those who distrust government? Unfortunately, we did have a question on that topic, and we found, lo and behold, it was about 43 to 45%. So it helped explain some of those paradoxes that do sometimes occur within the academic community. And it's about trying to engage and find out what might underlie some of those discrepancies. And try and hopefully offset, have an engagement in the public, because by that stage it's gone viral within on news media. So, I think that trying to handle that contradictory evidence in a sort of academically mature way is what we have to try and do.
Excellent. Thanks for that round of comments to the question. I would like to before I pass it back to Lignis, I would like to ask Sarah from the national from NIHSS to address a specific question that has to do with methodological integration. A lot of the comments that have been posed now has to do with elevating science communication, the rigor of the scientific method. So if we're talking about multidisciplinarity and bringing different, the insights from different disciplines together, we are also talking about the integration of methodology. Are there any points that we need to bear in mind when it comes to the integration of social sciences and in the COVID-19 response? This question is addressed to Sarah in particular.
Thank you. There has been a tendency it's part of how we've understood a health crisis, COVID-19, where there's been a heavy emphasis on numbers. So how many have been vaccinated, how many are positive, and where they are. And that's useful information, and that's useful type of data and methodology that's very quantitative, that's very at times very positivist in many ways. What I think the group, and what I'm hearing as well from others that I have not heard before, is that there's other ways of knowing, other ways of collecting data that should be prioritized as equally so. So the stories that individuals who are experiencing COVID directly and indirectly, that's still a legitimate sources of data. And spending time in communities, again, new sources of data that should be prioritized. I think that linked to the previous question, contradictions in data, whether it's qualitative or quantitative, whether it's storytelling, whether it's puppetry, whether it's going to archives for that matter, those contradictions should exist. And they are part of us saying that knowledge has, it's a spectrum. And as we try to understand complex matters that don't have readily made answers, that complexity, those contradictions should also be allowed. So there has been a tendency as well to think that creating myths around challenges such as a pandemic we should find a way of quelling such myths, because myths don't take us forward. Myths have a powerful way of educating us as we grapple with complex matters. I also think that when we think about new methodologies, we should also not be elitist. Let's go to these communities and individuals and ask them, how do they make sense of their lived reality? Thanks.
Excellent. Thanks for those powerful points. I will pass it back to Prof. Simbai.
Okay, thank you so much, Erica. We just need to remember that given the nature of this conference, that actually we have participants who are drawn from across the world. The next question was posed by Norris, who I think is from the USA. And he posed the following, I was wondering if South Africa had political actors that were actively spreading virus and vaccine disinformation, or even misinformation, like Trump and the Trumpists, that they've heard or still have in the United States. Could we enlighten our colleagues? Who wants to take a crack at that? Ishira, your hand is still up. You are most welcome. Or anyone from the panel. Are there some politicians who are driving?
Yeah, yes,
that
Prof,
agenda?
I can take it.
Yes, go ahead, Chabu.
Yes, so I think I would answer the question with the yes, and we have seen, for example, through our analysis of various data, that prominent politicians, which I may not name, particularly in the beginning of the pandemic, where they are the ones who are promoting misinformation, posting on Twitter in fake news or misinformation. But even now with vaccination, for example, we have seen political leaders who are probably also religious as well, trying to use religion to actually discount the efficacy of vaccination. So there are stories like that in South Africa. But of course, even within the general society, and I think just to also agree with Sarah, is that nowadays we've got a situation whereby the communities or the citizens are producing and consuming information themselves. So it's no longer just the researchers, who are the creators of knowledge, or correct or not. And we see that is happening. And because of the platforms that are provided by technology, we find that the society then trusts a number of people over and above the experts, including the politicians. For example, people on social media, they have a number of following, and sometimes the followings they have, they exceed what we as experts have. So yes, yeah, indeed, we have similar cases in South Africa. Thanks, Prof. Prof, you are muted.
Likeness, you're muted.
Sorry. I was saying over to Erica, and then I was looking at my time to say we are close to the end. There is one other question that was posed. Maybe I'll quickly go through that. And it's from Emmanuel. And Emmanuel seems to be familiar with the debates. He said the contradictions are not only amongst scientists and academic people, but there were also positions, for example, when you have heard again Trump and his Brazilian counterpart championing about the use of the anti-malaria drug hydroxychloroquine as coronavirus treatment. Basically, is wondering if the panel has got any views about this. I suppose even within our context, there were suggestions that there were alternative treatments. Go ahead, Mark.
Thank you. And if Manuel would forgive me, I'm going to start a little earlier than the specific around the, but on the issue of conflict, it's very important what Sarah was saying, that conflict must arise. It's necessary, but we're talking about different kinds here. So some of it is sort of unevidence-based or differently evidence-based, and that's in a way has a strategy. But I want to raise that within the NPDO, we've had a very nice discussion, and it's ongoing, that when we're comparing data sets of different scales, so some are on a small scale, but more regular updates, some are massive across the whole country, but only go once. There's various things that are of different representativities. It's crucial that we unpick it. So the example that Ben Roberts gave, that the conflict took them deeper in, and then the comparison, it wasn't satisfying. They found an answer. They actually understood a lot more about both surveys after that inquiry. So to an extent, one at the NPDO level, we need to be, as this colleagues are all saying, open to unpacking methodologies, definitions, principles, and even prejudices. That's very important that we look at that too when we're doing with this social science type of work. So then more specifically on the drug thing, I don't really have a concrete thing to say on the drug example, but I do think there's important regulation work that has to stay in step with this. But I think what we're talking about is the leading edge. So I think we haven't yet got onto the regulation of things. That's another important dimension. Thank you.
They don't want to have children, but the unemployed couples.
Okay, sorry, Ashwell, your mic is on.
Thank you.
I think that's what we have enough time for. And back to you, Ashwell.
Thank you, Likeness, and thank you for all the questions. Thanks. We now hand over to Erica. Erica, you will do the closure.
Excellent. Thank you. Thank you so much. Also, thank you to the organizers for giving me an opportunity to not only participate in the questions and answers, but also to reflect and to give some closing remarks. It is clear that in these challenging times, creativity, scientific evidence, and the thoughtful application of knowledge are needed in all aspects of life. The COVID-19 pandemic has created these unprecedented challenges for local and national decision makers across South Africa and everywhere else in the world, who are being asked to make many varied, quick, and very complex decisions. And incredible efforts have been made in a short space of time. We've heard about some of those, to pull from diverse sources of knowledge and evidence to make critical decisions to contain the virus and mitigate some of the social impacts. The range and the urgency of evidence needed for decision making is constantly growing, and as the challenges evolve, they prevail, and they pose new needs for evidence. This creates yet another hurdle in thinking about the types and the variety of measures, evidence, data that is needed to help society through these multiple impacts of COVID-19. So we've heard today about the huge efforts that have been made to put together such evidence. We in South Africa, it's clear that we have excellent research teams producing a range of highly relevant data and evidence informing various social dimensions coming from the social sciences. A lot has been discussed, but instead of summarizing, I would like to conclude with 3 points that I take away with me from this discussion. So my first point is to put emphasis on the importance of multidisciplinarity. What we've heard today is that we need all disciplines to bring light to the complexity of this crisis, and it is essential that we make efforts not only to bring together the knowledge of different disciplines side by side, but to make efforts towards the integration of such knowledge and such evidence. We've heard also about the conflicts, about the contradictions, and all of that requires further thinking when it comes to that integration effort that needs to take place. Multidisciplinarity seems to be a key to build strong data ecosystems. But if it's so important, why doesn't it happen more often? Right? It's difficult. It's not easy. Each discipline has its methods, its own language, its community of practice, its comfort zones, and it's not easy to bring those together. It often doesn't happen naturally, and it requires deliberate efforts. And these circumstances that we're living in, I think, present us with a very critical moment in time to push into this direction of knowledge integration. Further questions have emerged around what multidisciplinarity means in the context of the future of data collection. We've heard that there are many groups already collecting extremely valuable data that need to be brought together, and the National Policy Data Observatory is a very important move towards that direction, and more of that consolidation needs to happen. So how do we draw others into this effort? A second related point has to do with the importance of preserving the rigor in data collection and the importance of experimentation. And those two efforts need to run in parallel. And here I would argue that while bringing together the insights from different disciplines is essential, In this process of experimentation, we may also need to look at transdisciplinarity, bringing knowledge from other stakeholders outside academia in building solutions. This means bringing not only policy academia, but also policymakers, private sector, communities, finding ways to enable the youth, women, informal actors to be active and equal participants in the evolution of these data ecosystems. So it's important to acknowledge that there's value in all types of expertise and different types of knowledge and the importance of bringing it together. A third point that I want to mention is the final one, is the need for a healthy level of integration in our data ecosystem. A rich, integrated data ecosystem helps make decisions more responsibly and predict more accurately the various angles of impact. And again, it must be developed. It doesn't happen by itself. Partnerships were mentioned over and over again as a key aspect of this data ecosystem health or functionality. And here it's important to make the most, to think about the role that digital technologies could play in integrating these various data sources. So setting up the institutional structures for data sharing, as well as creating a culture of openness, transparency, sharing knowledge, and have been mentioned as being essential. So this is a key conversation that needs to continue. And the urgency of this moment calls for these efforts to blend in with ongoing efforts to develop the analytical capabilities to turn this data into more agile and appropriate decision making. Thank you so much for allowing me to make these closing remarks.
Thank you very much for those beautiful and appropriate closing remarks. Thanks, Erica. And in summary, we need to work together, support each other's effort, follow common standards so that we can integrate. And I want to thank the Deputy Minister, Mr. Buti Manamela, the DG Phil Mujwaha, and our Statistician General, Mr. Rasenga Malaleke, for their inputs into these sessions, and for all other people who presented and prepared and made the session possible. Thank you for those. The session is now closed. Thank you. And bye.
Thank you, Chair, for the good job. Bye.
Bye and well done.
Thank
Thanks.
you, everybody.
Thank you.
Thank you.
On its way. DG, can you hear me?
Yes, I can, Dan.
I will start 12:15. So it's a
Thank
short
you.
break. Thank you. everyone. And it is my great privilege to welcome you to the closing session of Science Forum South Africa 2021. My name is Don Tue, and I have the privilege to be a Deputy Director General in the Department of Science and Innovation, where I look after the portfolio for international cooperation. And I will be your moderator for this afternoon's session. What we want to do this afternoon is to just very briefly reflect on the exciting program we had over the past 3 days, and also share with you some of the key messages which we thought were important from this forum. But then also, very importantly, we want to pay tribute to one of Africa's foremost science leaders, and that is the African Union's Commissioner for Education, Science, Technology and Innovation, Commissioner Sarah Anyang Akbor, who, as many of you will know, is coming to the end of her current term of duty. She's been a staunch supporter of Science Forum South Africa over the years, and we have invited her as our guest of honor for this session, and we are hopeful that she will join us for a few short remarks. You will also know that the Science Forum South Africa 21 has been announced as a preparatory session, almost so to speak, as an important milestone on the road to South Africa's historic hosting of the World Science Forum 2022 in Cape Town. And even though it's no longer a secret, we will be making that important announcement this afternoon. And we will also have a special message from Professor Tamas Freund from the Hungarian Academy of Sciences, who is the co-chair of the World Science Forum Steering Committee. And then, of course, with an important event such as the one we've just had, it is very important to conclude with a word of thanks and thank everyone who made this event possible. We are now going to proceed to the reflection on the Science Forum South Africa 2021. One of the themes throughout the proceedings has been the focus on investment in the youth, preparing the next generation of researchers. In the Department of Science and Innovation, we are not only concerned with that important mission, but also preparing the next generation of science, technology, and innovation policy professionals of the next generation of public servants. And we have therefore entrusted a large part of this year's event, the organization to our younger generation, a brighter generation of colleagues in the Department of Science and Innovation. They were headed by Mr. Tapelo Kepadisa, who will be familiar to all the session organizers, all those who contributed to this year's forum, as he was coordinating that. And we thought it only appropriate to invite Tapelo to share with us his reflection on this year's forum. Tapelo, over to you.
Thank you very much, DDG Banditoid. I am sharing my screen to do the presentation that I've prepared to reflect on the overall Science Forum South Africa 2021. Yeah. Just a moment, DDJ.
Not to worry at all, Tapelo. This is, despite all the practice the world has had over the past 2 years of moving online digital, this occurrence has happened also throughout this forum. So that's absolutely no challenge at all. And there you are good to go. The floor is yours.
Thank you once again, DDG. Before I start my presentation, I would like to acknowledge the presence of our Director General, Dr. Phil Mtwaka, who is on the call. I'm told that we will also be joined by the AU Commissioner. I don't know whether she managed to join now, but I would also like to acknowledge her presence if she joined the call. DDJ, you asked me that I reflect on the overall Science Forum South Africa. How did it go? Who participated? Where? So on and so forth. So this is the presentation I prepared after having the discussion with you. By the way, the request has came in this morning, early this morning. So, but I managed to prepare something. So if you look at the numbers, you will realize that the overall number of people who participated in Science Forum South Africa 2021 is 3,983. I think it's a good number. It's a fair number indeed. We have a very good participation of individuals from all over the world. When number two here, my bullet here is talking about the total number of countries who participated in this year's Science Forum South Africa. We have 48 countries participating. We derived this data, or we got this data from someone who was managing people who were registered for the forum. So I can assure people who have joined this call that the overall countries which participated in Science Forum South Africa 2021 was away from 48 countries, and overall we had 59 different sessions. Very, very interesting sessions. It was not easy at all to choose where do you went to be, because all of them they were very, very exciting, catchy topics. Presenters being over prepared. It was very, very difficult for one to choose and say I am going to attend this particular session. All of them. We also like to compliment the session organizers. They were very prepared. Presentation were spot on. We were happy about the level of discussion that ensued during the sessions. So if you have been following discussion, you will realize that it has been emphasized over and over from one session to another, from one speaker to another, that we indeed have to harness science to respond to societal challenges. We are sitting with a number of challenges, being the COVID-19, the issue of poverty, the issue of climate change. And there is no way in which science does not have any role whatsoever to play in solving COVID-19. We have the role to play as scientists. So science can be harnessed to address challenges such as COVID-19, the issue of poverty, the issue of climate change. Now, it is through science that such challenges can be addressed. It has been overemphasized during session that open science is the way to go. Research should be done, but the research findings should not be monopolized, or people should not conduct research and therefore not wanting to share the research findings with everyone. The findings science should be open so that it can be beneficial to all of us. We were reminded during session that still the issue of science diplomacy is still a way to go. We are scientists, we are sitting at different countries of the world, but partnership is very important because no one can go far if you want to work alone. So it came out very, very clear during the session that the issue of science diplomacy is something that we should still pursue, because we like I said, we are scientists, we are based in different countries, but partnerships are necessary so that we work together. By working together, we can go far and we can achieve at the shorter space compared to when you are working as an individual. So this slide is the last slide from our presentation. Remember, we agreed that it should be a very, very short presentation. It's talking about, we are taking stock as to whether we are accompanied by organizing Science Forum 2021. I think we did fairly well. We did fairly well in the sense that Science Forum South Africa 2021, it focused on enhancing the impact of science in the society. You see, when we do science, it's very, very important that we do science that has impact on the community. If you are doing science that is not impact on the community, people will even deem it to be irrelevant. We were told, we know, we had discussion that during this forum focus, we were on enhancing the impact of science in the community. The forum this year also, it fostered cooperation to advance science. I indicated earlier about the number of countries who participated in this Science Forum South Africa. You can see that indeed people responded positively. And when people participate in such forums, they do the talking. From there, they forge partnerships. It's through such platforms that people can add talking, and then we advance science by doing that. It should also be borne in mind that the forum this year, it showcased excellence in African science. Something that we are not doing well to profile our African science, but it indeed showcase excellence. For example, in this year, we had 24 African countries participating in Science Forum South Africa. And when you hear their discussion, you can really see that there is science in the African continent, but the issue is that how do we profile it? Indeed, science is taking place in Africa. And the last point that I want to talk about, DG, is the issue of my observation that our forum it really ignited conversation about science. We know that even today people are talking, people attended different sessions, people were excited about what was discussed, people were excited about presenters, so on and so forth. They are talking, there is so value in Science Forum South Africa, which ignited conversation among them as scientists. That's all I've prepared, DDG, for reflection on Science Forum South Africa 2021. South Africa will be hosting in 2022, but we will talk more on that one. But we are so willing to get support that we got this year for Science Forum 2022, organized under the theme of Science for Social Justice, taking place in Cape Town in December next year. But I'll leave that to you, DDG, to expand more on that. Thank you very much.
Thank you very much. Thank you very much, Tapelo. Much appreciated for that excellent overview of the Science Forum South Africa 2021, which is really, I think, a testimony, a monument to all the work of you and your colleagues. And indeed, that really is appreciated by all in the department. And even if you call me DDG, that isn't really important. We're one team, and thank you very much for that. I also really enjoyed you showing the slides with the photos of previous editions of the Science Forum South Africa. I think reminding our audience of when President Ramaphosa spoke at the opening session in 2017, I noticed, and then the packed rooms at the CSIR International Convention Center. And I should really give a shout out to the team at the CSIR International Convention Center, which despite the challenges of the COVID-19 pandemic, which made it impossible for us to be together in large numbers at their fantastic facility, really provide us with excellent support to make sure that even if we may have been physically apart, we were certainly not apart in the discussion. And with that, we look forward to optimistic, because science inspires optimism. Science inspires hope in the future, that a day will come when we are going to again be united on a specific site in the conference facility. So thank you very much, Tapelo, for that. Now, colleagues, I do not see Commissioner Sarah, or colleagues, I shouldn't say colleagues, it shows you I'm a bureaucrat, and I shouldn't, bureaucrats shouldn't perhaps be speaking at an event such as this. I should say friends, partners of Science Forum South Africa. We do not see Commissioner Sarah Anyang Akbar online yet. But I just want to pay a very short tribute to her from the South African Department of Science and Innovation, and I think indeed from all with the interests of African science at heart, because over the years, Commissioner Sarah has been an outstanding champion for Science Forum South Africa. She didn't miss any of them. She had attended several of them in person, and certainly on behalf of my minister and my Director General, we can just express South Africa's deep appreciation for the service Commissioner Sarah has rendered African science. And I would just perhaps put it on three key points. She's been a champion, first of all, for science in the African Union, ensuring that there's not been a topical issue which the African Union had to confront, whether it's COVID-19, whether it's food security, whether it's investment in African youth, where Commissioner Sarah didn't play a critical role to ensure that science featured prominently in those policy discussions. But the Commissioner has also and continues to be a champion really to harness the programs, the instruments, the resources of the African Union to advance Pan-African cooperation in science. And that is so crucial, as we've discussed also at this platform, that for African science to progress, we need to expand and deepen the intra-African, the Pan-African sharing of resources, of experience, and expertise. And I think then lastly, and perhaps most importantly, the Commissioner has also made sure that science, the values of science, the values of solidarity, of caring and responsiveness has infused really the broader work of the African Union, and really harnessing the potential of the soft power of science for the advancement of the African agenda. So Commissioner, we do hope that you will still join us. But if you don't, please just accept on behalf of South Africa, and I think I should say on behalf of the Science Forum South Africa, because as Tapelo has just said, the Science Forum South Africa brings the world together, brings Africa together, our deep appreciation for your service to African science. But we will then proceed then with our look at the future. And as it has already been hinted at many times, is that next year there will not be a Science Forum South Africa for the first time since 2015. But please do not be too disappointed, because we have something much better. We may not be in our beautiful executive capital city of South Africa, of Tshwane next year. We will be in our legislative capital, the city of Cape Town, because South Africa will have in December 2022 the huge privilege, because we really see it as a privilege, but indeed we also see it as a responsibility to be hosting for the first time in Africa the World Science Forum. And for those not familiar with the World Science Forum, just to a little bit of background, this is a global event which has been organized since 1999. It first and foremost forms part of the UNESCO dispensation for global science, with the historic support and leadership of the Hungarian Academy of Science, which played a pioneering leadership role when it hosted the first ever World Science Forum in 1999 in Budapest. And then a whole range of critical partners, global science partners, then form part of the family, the custodian of the World Science Forum, of course, the International Science Council, the Inter-Academic Partnership, the World Academy of Sciences, the American Association for the Advancement of Science, and the European Academy Science Advisory Council. And from the Department of Science and Innovation from South Africa, we are very grateful for the trust the World Science Forum Consortium has put into us to bring this very important event for the first time to Africa. The event has been to Europe, to the Americas, to Asia, and this is the first time it is coming to South Africa. It will take place, and we urge you to already reserve your diaries. It will be the second week of December, the 5th to the 9th of December 2022 in Cape Town. A whole series of events are being planned, and at the initiative of our Minister, Dr. Blayton Zimandi, very topical, the theme for the 2022 forum will be Science for Social Justice. We strongly believe that the cause of social justice is one in which science can and should play a critical role to achieve, but also motivates and brings science and broader society together. Of course, we are very well aware, and you will may certainly be asking yourself that question, what type of world we will be in December 2022. Would it be possible to organize a large-scale event with physical attendance? That's certainly our hope, and that's what we're working to. And we are certainly working to be hosting the World of Science in Cape Town. But of course, science, as we've said earlier, is also being responsive. It's also being flexible, and plans are in place that if need be, we will have what is now known in the common terminology as a hybrid event with opportunities for participants to join from all over the world. And that will in any event be part of the World Science Forum 2022, because part of this course for Science for Social Justice is making sure that science is inclusive, that not only the scientific enterprise itself is inclusive, but it is also science which serves the interests of all, and therefore we will exploit and leverage the potential of digital platforms, which we've all learned over the past 2 years how to use, to make sure that that is also put at service of the World Science Forum 2022. As I've said, the theme of Science for Social Justice will be has been chosen as the theme, and within this, a whole range of priority themes will receive attention. Some of which I just want to leave with you, almost like an appetizer. And of course, if you had been following the discussions at Science Forum South Africa 2021 over the past 3 days, you would have seen that many of these had received already attention in our program. As we've said, we saw the Science Forum South Africa 2021 really as a preparation for Cape Town next year. Of course, science and in the global fight against poverty, in eliminating unemployment and inequality will be central to the theme. We cannot be and will not be insensitive to the questions related to COVID-19. What are the lessons we've learned, specifically with regard to the science response to policy advice, as with climate change, just transition, environment sustainability. These will be issues which will be high on the agenda. We are very proud to be hosting this on behalf of Africa, for Africa, but also with Africa, our partners on our own continent, and therefore the African agenda for science will be a priority theme, including to make sure that African science is rightfully recognized and afforded its rightful place to participate and to contribute to global science. But we'll also be looking at topical themes such as frontier technologies, for example, the governance of artificial intelligence, and what is really required to make sure that the potential of these technologies, of which we're all convinced are harnessed to advance the cause for science for social justice. And then science diplomacy will be a central theme, specifically at a time, as recent events have shown and indeed continue to show, where international friendship, when solidarity, when the commitment to multilateralism is under threat. We cannot run away from that, and we believe that that threat must be countered through the power of science, and therefore science diplomacy will be a key theme also for Cape Town 2023. So we very much hope to see all of you to join the conversation, as Tapelo said, to further ignite conversations at World Science Forum South Africa. The good news is that not only can we invite you to be part of the conversation, in the spirit of open science, we invite you to shape the conversation. There's a call for proposal which is open. You see the URL address there on the screen. It will close at the end of January. So there's enough time where we invite anyone with an interest in the theme of science for social justice to put forward your proposals for sessions, for debates at the World Science Forum 2022. There is an international panel of the World Science Forum partners. We'll be reviewing these sessions in order to make sure that we compile a program which is relevant, which is topical, and really focused on the objective of the event. And that we can only achieve if this is a program which is not top-down, but really comes from those whose interests this event at heart. So warmly invite all of you to submit your proposals to organize a session at the World Science Forum 2022 in Cape Town. So I would hopefully we have whetted your appetite and look forward to be working with all of you in the build-up to this very important event. As I've said, the World Science Forum is a global partnership with the very important leadership historically of the Hungarian Academy of Science. And I would now like us to invite Professor Tamás Freund, who is the president of the Hungarian Academy of Science. He is the co-chair of the World Science Forum Steering Committee, who is responsible for the overall oversight of the program. And we have a message from Professor Freund to the Science Forum South Africa. So if we could please have the message, the video message from Professor Freund, please.
Dear Minister Nzimande, Your Excellencies, ladies and gentlemen, it is a great pleasure for me to greet you all at the closing session of the Science Forum South Africa and to join the announcement of the 2022 Cape Town World Science Forum. I'm truly sorry that I can't be there with you in Pretoria in person, but the pandemic has taught us to appreciate and embrace these online opportunities as well. While they can hardly substitute face-to-face meetings, they help us keep the momentum of international scientific collaboration and indeed provide a platform for inspiring discussions, as it has been clearly demonstrated in the past 3 days as well. For this reason, let me first congratulate the organizers of Science Forum South Africa, who made an excellent job, not only in putting together an exciting agenda, but also in transferring this event into the digital space on such short notice. Their dedication only confirms that the steering committee of the World Science Forum could not have chosen a better place for the 10th edition of our conference than South Africa. The fact that we are talking about the 10th edition already indicates that the World Science Forum builds on a history of over 20 years. Its origins date back to the 1999 UNESCO World Conference on Science held in Budapest, Hungary, which was the first intergovernmental conference dedicated to the role and responsibilities of science in the 21st century. This was the event that inspired my predecessors at the Hungarian Academy of Sciences to initiate a series of follow-up meetings organized together with UNESCO, the International Science Council, and AAAS, and made sure that these important discussions were continued on a biennial basis. A decade later, the World Science Forum acquired a new global dimension. In 2013, it was for the first time organized with great success outside Europe by an emerging scientific power, Brazil. 4 years later, the forum was hosted by Jordan to become a monument in the history of science gatherings in the Middle East. I really think this is an excellent platform to follow, excellent pattern to follow. Every second occasion, the conference should take place in a country whose growing commitment towards science can truly profit from an event of this magnitude, while in between these fora, WSF returns to Hungary, its country of origin. The development of this forum in size, in attendance, in prestige, or even in press coverage has been spectacular, and its significance is in integrating the world's diverse scientific communities is highly praised. Now it is the turn of South Africa to take this enterprise even further and promote science on the national, regional, and global levels. The fact that the World Science Forum will be hosted in Cape Town is not only an acknowledgement to the achievements of South Africa in research and innovation, but also a testament to the growing importance of Africa in science. I am aware of the responsibility and burden of the organization of an international forum of this size that is laying on the host country, especially in these unprecedented, uncertain times. Our sincere acknowledgements are due to the South African Department of Science and Innovation for accepting and pursuing this task in a region that is already not short of challenges. I can assure you that the Hungarian Academy of Sciences will be there to support you, and with the help of the long-standing partner organizations of the World Science Forum series, UNESCO, the International Science Council, the American Association for the Advancement of Science, the Inter-Academy Partnership, TWAS, the World Academy of Sciences, and the European Academy's Science Advisory Council, we will do everything we can to complete this ambitious task. I feel a great eagerness among our partners to help deliver a memorable World Science Forum in December 2022, and a true enthusiasm for its central theme, Science for Social Justice. This year's program of the Science Forum South Africa has already given us a taste of what is to be expected under this ambitious title. The role of science in fighting inequalities, the challenges of environmental sustainability, the issues of the regulation of disruptive technologies, or the African agenda for science are just a few of the topics we will surely hear about. The list could, of course, go on, but let me just add one more to the end, the post-COVID research. I'm adding it to the list not only because of its unquestionable relevance, but also because I very much hope that in the year from now, we will indeed live in an at least largely post-COVID world. a world that will let us meet and discuss about these important challenges in person again. This is above all that I wish for South Africa, and this is how I look forward to meeting you all in Cape Town at the World Science Forum in 2022. Thank you for your attention.
Thank you very much, Professor Freund, for that message, and indeed for the confidence and the support from all the World Science Forum partners. We will certainly honor that trust. We're coming towards the end of this program, but of course, after an exciting and impactful event such as we've had over the past few days, it is very important to acknowledge all those who've contributed to it. And I would therefore like to invite my colleague, Ms. Mampe Chaba, who is a Chief Director in our department. She looks after the Africa and the multilateral cooperation program. Many of their outstanding work featured very prominently on this year's forum, and we therefore thought it was appropriate just to ask Mampe to do the vote of thanks to bring the Science Forum South Africa 21 to a close. Over to you, Mampe.
Thank you very much, Dan, my DDG. My role this afternoon is to acknowledge and recognize all of the stakeholders that have contributed to the successful 2021 Science Forum. This is not an easy task, as there are so many of you who have cheered us on and ensured a successful event that this Science Forum has been. I'd first like to recognize Dr. Blake Nzimande, the Minister of Higher Education, Science and Technology, South Africa, for his leadership and advice in not only guiding the preparations of this year's Science Forum, but in also leading the decision process to respond to the many socioeconomic challenges that South Africa faces. Deputy Minister, Mr. Putimanamela, for always availing yourself to represent the DSI in engaging in very difficult conversations with a variety of stakeholders, in particular, the young people of South Africa. We do not take this effort to engage and listen to young people for granted, as they also need to be heard. Dr. Phil Mdwaga, our Director General, for your unfailing support, guidance, and willingness to listen to what we all have to say, whether it's from the representatives of the NSI, the international community, or even from the DSI. You have lived to your role as the Dr. Phil, and we are grateful for that. This year's Science Forum has had a total of 59 sessions, as we have heard, 10 of which were hosted or organized by the DSI, ICR officials, International Cooperation on Resources officials, under the leadership of my DDG, Mr. Dan Tutoy. We had another 10 or so that were organized by the rest of the DSI programs. About 15 sessions were organized by our partners within the National System of Innovation. These are our entities, universities within the system, and other South African institutions. And we have had a total of 22 sessions that were organized and led by international partners. We would have liked to thank each and every one of you by name, but with the 5 minutes limited period I have been given, this is not possible. You continue to ensure that the Science Forum lives up to its theme, igniting conversations about science. Let the conversations not wait for December 2022. Please continue to engage and act on the recommendations made during these illuminating conversations we've had in the 2.5 days, and hold us as government accountable and ensure that we keep the commitments that were made during the forum. All of the organizations and individuals that supported the Science Forum, Minister, Deputy Minister, and DG, let me echo the acknowledgement made by my DDG, Her Excellency Professor Sarah Anyang Ekbo, whose 4-year term comes to an end as the AU Commissioner for Human Science, Resources, Science and Technology is coming to an end. Leadership, her infectious passion and advice has taken the AU HRST Commission to new heights during a very difficult time of the COVID-19 pandemic. Her support towards South Africa's chairship of the AU in the year 2020-2021 has enabled South Africa and the AUC to successfully host the Science Forum, but to also ensure that the AUC shines as a beacon of hope during a especially trying time in the history of the world. As a leader, an academic, a promoter of women in science, a sister in the AU, she leaves a major gap and will miss her infectious laugh. She leaves a legacy which the rest of the continent will endeavor to carry forward under the new HST Commissioner, Professor Mohamed Belosini from Algeria. Science Forum is the brainchild of my DDG, Mr. Dan du Toit. 7 years ago, when we hosted the inaugural Science Forum, we had no idea that this annual event would be this huge, this successful, this exciting, and result in the impact we've observed over the years. We are grateful for his leadership, passion, enthusiasm to drive this annual event. Mr. Dan du Toit has led a brilliant team of young, enthusiastic, capable, and passionate people within the DSI that have done a brilliant job, and in particular to recognize also Mr. Thapelo Kepadisa, who rose to the occasion in serving as his right-hand man in organizing this event. We're also grateful to Farm, who did an excellent job in supporting this virtual event. We have learned that it's possible, and this is the new norm that we can engage virtually to meet on an annual basis. Last but not least, the 2021 Science Forum saw a record of 3,983 digital connections. We're trying to get that to 4,000. I don't know if we've reached that figure as yet, but that included representatives from 48 countries, 24 of which were from Africa, as we have heard. And this year's forum has also, as usual, attracted scientists, civil society, young people, private sector representatives, and truly lived to its theme of igniting conversations about science. As I conclude, I'd like us all to recognize all of the role players, including those that I might have omitted, who contributed to a successful 2021 Science Forum. We will see you, and I say see you with the hope that we will physically meet in Cape Town at the World Science Forum in 2022. Can we please give ourselves a round of applause as I close? Thank you, DDG.
Thank you very much, Mampe, for those very fitting closing remarks. This brings to an end Science Forum South Africa 2021. For all of those who will be enjoying end of year holidays, we wish you safe, enjoyable holiday. We ask, of course, everyone to keep each other safe. So we are still confronting this pandemic, but let us continue to be inspired and to be guided by the optimism and the hope which science brings. Thank you very much, and we'll see you next year.
Thank you.